Good morning, everyone, and welcome to the first edition of the Seniors, Veterans, and Adults with Special Needs Committee. So, Madam Secretary, please call the roll.
Senator Dondero Loop. Senator Krasner.
Here.
Vice Chair Brown May.
Here.
Assemblyman De Silva. Assemblyman Gray.
Here.
Chair Spearman.
Here, and please mark the members who are absent at this point. Mark them present once they arrive. So I'd like to take just a moment to welcome all of you all who are here who have taken the time on Valentine's Day to come out and be with us. And since I'm a heathen and scheduled this meeting on Valentine's Day, I'm going to ask the members of the committee and those of you who will be presenting today, if you want to do a shout out to your Valentine, please do that. And before you come up, make sure you text somebody and tell them to tape it so that the person can hear it or see it, okay? So everyone, we've got a quorum. Let me do this. I want to take a couple of minutes to have our committee members and our staff to introduce themselves, and the same holds true for you all. Please, when you introduce yourself, please say hi to your Valentine or Valentines, whomever that may be, okay? So I'll tell you what, let's start with our vice chair.
Well, thank you, Senator. Assemblywoman Tracy Brown May. I proudly represent Assembly District 42. I'm very pleased to be the vice chair of this interim committee. This issue area has been something I've focused on for the last 20 years. So it's nice to be at the dais finally instead of at the testimony table. How very interesting is that? My shout out today would have to go to Jeff May. The reason I show up on time and looking fabulous every day is Jeff May. So, happy Valentine's Day.
Thank you. Senator Dondero Loop.
Thank you very much. Marilyn Dondero Loop, representing Senate District 8 here in Las Vegas on the West End. And I've been around for a while, and so I've served on a lot of committees, and it's my pleasure to serve on this one. I think I'm almost 100% on every committee, but that's okay because I have a lot of knowledge about Nevada, and it is my home. And my shout out today probably should go to my children, but I really have to give the shout out to the staff of the legislature who keeps us all running, because I depend on every division weekly to assist me with what I do in these positions. So I'll include my children there so that I don't get in trouble. But other than that, thank you very much.
Thank you. Let's go up north. Senator Krasner. Senator Krasner, I'm sorry.
Thank you.
Good
morning, Chair Spearman and members of the committee. I'm Senator Lisa Krasner, proudly representing State Senate District 16, and I'm very happy to be here today. I was first elected to the Assembly in 2016, served 3 sessions there, multiple special sessions. Served my first session in the Senate, elected to the Senate in 2022, and happy to be here today for the Interim Committee on Seniors, Veterans, and Persons with Special Needs. Shout out to Valentine's Day would be my husband and 2 children. Thank you.
Thank you. Assemblyman Gray.
Good morning, Madam Chair. Ken Gray, representing Assembly District 39, all of Douglas and the Central Lyon County Corridor. My shout out goes to my wife of 29 years and both my daughters. And I'd like to say I'm very happy to be sitting on this interim committee. It's one I wanted to serve on. Having been a service member in the Air Force for 26 years, it means a lot to me. Thanks.
Thank you. And I'm going to ask our staff now to do the same. Introduce yourself, a little bit about yourself, and shout out. Okay? So we'll start right here. Okay.
Thank you, Chair Spearman. My name is David Noss from the Legal Division. I've been with the LCB for 3.5 years and was with Health and Human Services, the Assembly Committee on Health and Human Services last interim. This is my first time working on this interim committee. I've worked with the NYL, the Nevada Youth Legislature, previous interim committees. So I'm excited to be here, and my shout outs go as well to my wife and my 3 kids, Deirdre, Avila, and Colby.
Thank you. Stay down here with staff. Destiny?
Good morning, staff and committee members. My name is Destiny Cooper, Research Division, Legislative Council Bureau. This is my first interim committee, so first time staffing senior citizens, veterans, and adults with special needs. During the session, I staffed Senate HHS and very excited to be here with this staff that we have up here behind the dais today. And my Valentine would have to be both Coach Coops, Coach Coop, my dad at UNLV, and my Coach Coop at Oregon State. Thank you.
Jennifer?
Thank you. My name is Jennifer Rudy, and I have been with the Research Division since 2001. And I would like to say, I guess my Valentine's shout out would be to my husband, Sean, and my daughters, Julia and Sophia. And I have to say thank you very much to Senator Dondero Loop for getting us all sugared up before the meeting. Thank you.
It's the teacher in her. We have anybody up north? I'm trying to see. Is it Eric? Who's up there?
Yes.
Eric, yeah, okay.
Eric Robbins, LCB Legal. I am just serving as backup counsel on this committee to David, who is primary counsel. This will be my 4th time staffing this interim committee, and I'm excited to be here. And that's about all I got. Thanks.
Okay, Davis. And I'm trying to see, but the camera's not on you all the time. So, Davis, are you there? Hello?
Thank you, Chair Spearman. Davis Florence, Research Division, just providing some assistance today with Destiny and Jennifer filling in for the Carson City office. And my Valentine's shout out goes to my girlfriend, Amanda. Thank you.
Thank you. Have we gotten everybody? I think we've gotten everybody except me. So I am Senator Pat Spearman. I represent Senate District 1, which is most of North Las Vegas. I was elected in 2012, and this is, I think, my 4th time serving on this committee, and it might be the 2nd time that I've chaired. I am honored to be here and to be serving as a veteran of the United States Army Military Police Corps. Many of you already know that it's my passion to make sure that we take care of our veterans, and anyone who disrespects our veterans, I got a problem with that. So I'm glad to be here, and seniors and adults with special needs are also near and dear to my heart, so I am really honored to be here. My shout out has to go to the love of my life, Doretha Williams, who has been a fantastic person, who has been in my life for about 3 years, but it feels like it's 30 because it's a good thing. It's a good thing. So I want to give a shout out to her, and also, since Senator Dondero Loop started it, to the staff and to my colleagues here at in the Nevada State Legislature. You know, I tell people a lot when I meet them at different conferences and things, I say, you know what, one of the things that I'm most proud of in Nevada is that we were the first female majority legislature in the country. And everybody else had to catch up with us, and that's probably one of the reasons why we get stuff done, because we put it out there on the table. We know that there are people's lives that are depending upon it, and a lot of the craziness that goes on, you know, grandstanding and that sort of thing doesn't happen with us. Nothing special, nothing, no shade to the brothers, to the gentlemen, but if you look at our record, we've gotten a lot of stuff done since we have been a female majority. So just before we begin, I'd like to go through a couple of housekeeping items, and I did mine. Everyone, please turn off your phones or turn them down. Your ringtone is probably something that you really like, but someone at the table trying to get a message across to us probably doesn't care for that. So if you turn your phones down, I certainly would appreciate it. The other thing that I'd like to say is, excuse me, for those members who are joining us online, please mute your microphone when you're not speaking, but leave your camera on at all times. The committee will meet 4 times during the interim, and Las Vegas will serve as our primary meeting location with video conference to Carson City. Members and presenters may also attend virtually via Zoom, and everyone is encouraged to participate from whichever location is most convenient. The committee's meeting materials can be found on the Nevada Legislature's website, and you can also sign up for electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door and leave a business card. And that's true for here in Las Vegas or those in Carson City. If you do not testify, you may also want to sign in so there is a record of who is interested in in any particular topic, and in the event that the committee needs to contact you later. When testifying in person, this is really important. When testifying in person, please turn your microphones on and speak directly into the microphone. Please turn off the microphone when you're done speaking. We have listeners and viewers in Las Vegas and Carson City and other parts of the state, and perhaps even the country, that are trying to listen to hear what's going on. And when you don't speak into the mic and they're trying to listen, and that's what it sounds like to them. So please make sure that you turn the mic on, speak directly into it. And if you're one of those that likes to look around, make sure that you're still speaking at some point into the mic so people can hear what you're saying. We'll have public comment period at the beginning and the end of the meeting, and public comment is limited to 2 minutes per speaker. In addition to testifying in person, members of the public may provide public comment in 4 different ways, all of which are listed on the agenda. You can provide public comment by 1, calling 888-475-4499. That's 888-475-4499. Then pressing the meeting ID number 810-2934-1767. Meeting ID number again, 810-2934-1767, and then press the pound sign. You can also email comments to Senator Vetts at sn@lcb.nv.us. You can mail written comments to our Research Division, 401 South Carson Street in Carson City, Nevada, 89701, and you can fax your testimony at 775-684-6400. You can find all the phone numbers and fax numbers, email addresses, and such on the agenda. With that, let's get started. Any committee members, did I miss anything? Yeah, I want to say a very great thank you to Destiny. I think someone told her that whoever is staffing me in the policy division, I need a lot of help. So thank you so much for giving me the word for word intro. And so with that, let's start with public comment. Those who are physically here in either Las Vegas or in Carson City, anyone want to come to the table? And 2 minutes for public comment. Welcome.
Thank you.
Mm-hmm.
Thank you.
And I'm going to ask Ms. Cooper if she'll just keep time for me.
Thank you. I need to first get this out of the way. I'm happy Valentine's Day to my great husband of 55 years. If it wasn't for him, I wouldn't be sitting here right now. And my children, who are just absolutely adorable. Okay, now I'm going to start my testimony. Good morning, great people. Thanks for the opportunity to share a few of my concerns with you, experiences that make me want to cry, but I chose my God's granted smile. In June of 23, I was diagnosed with pneumonia on the East Coast. After returning home to NV to see a doctor, I was sent a bill for $1,200, of which $300 was a payment from me. I learned that the insurance company that the insurance company was billed for alcohol, cigarette use, which I have never chose. It was never my choice. I was told a directive was prepared for me by the doctor's office, prepared by the Senior Law Center years ago. I had it prepared. After my pneumonia my right eye was blared. When I asked a doctor, ophthalmologist, what he thought happened, he responded in a nasty tone, "You're old." Oh, I recently, January, went to the doctor for a yearly physical to address some other issues and to address some other issues. He gave me a pill that was very difficult to swallow and burned my throat. On the second visit, I texted them first and made them aware. On the second visit, which was February the 2nd, the doctor and I discussed second option. A $400 bill, two $400 bill payments were requested me between the first and the second visit. The insurance company said that the doctor never submitted the claim. On Friday the 3rd, on Friday the 2nd, the doctor wrote another prescription, the optional. On Friday the 3rd, I called the pharmacy to learn that they had the prescription, but there were no directives, no orders. The pharmacy and I called over 5 times each. I went into the office on Wednesday thinking that I could pick up the prescription. The office manager told the pharmacist while I was standing in front of her that she was going to send the directives, the orders right away. Today, Friday the 24th, the pharmacist still has not received the prescription. I called Monday, February the 12th, to request my records because the insurance company has assisted me in finding another provider. I was told that I could pick up the records on Tuesday the 13th before 12 p.m. I was there about 11 or after 1 p.m. at the rate of 60 cents per page. I agreed. I was told that I could pick them up on Tuesday before 12 and after 1. I went into the office on Tuesday at 11 o'clock only to be told that they would email them immediately at no cost. At about 4 p.m., I called to inform them that I had not received the email. I was told by the young lady that I could pick the records up today at 1 p.m. I will try again. What did I believe caused this friction? I requested the office order a product that the insurance would pay for and not me. I questioned the $400 bill. I requested an optional medication, my age, and my beautiful black skin. Thank you all for listening.
Thank you.
Can you please identify yourself for the record?
I'm sorry?
Can you please state your name for the record?
Thank you so much.
You're so welcome.
I'm trying to rush. Jacqueline R. Mitchell. Okay? Any other?
Yeah, thank you, Ms. Mitchell. Appreciate
You're
it.
welcome.
Mhm.
I certainly hope you all can help out with this because I'm sure I'm not the only one that's suffering.
Thank you, Ms. Mitchell. Anyone else here in Las Vegas? Anyone in Carson City? VPS, do we have anyone on the phones?
Thank you, Chair. The public lines are open and working. However, there are no callers to offer public comment at this time.
Okay, let's give it a couple of seconds in case someone is trying to figure out how to punch the buttons. Okay, still no one on the line?
No, Chair, there's no one on the line.
Okay, thank you so much. For those of you who may be new to committee meetings, during public comment, we don't make any comments afterwards. We do take note of everything that you say, and perhaps at a later date, we will bring the measure back, and there may be someone who will contact you for additional information, but during public comment, we don't make any comments or statements from the dais. So, thank you. All right, agenda item number 3, review of the committee's duties, and I'm going to ask Ms. Destiny Cooper, Research Division. Staff will provide an overview of the committee's duties and responsibility this interim. Ms. Cooper?
Thank you, Chair Spearman. For the record, my name is Destiny Cooper, and I'm a Senior Policy Analyst for the Research Division of the LCB. I'm very excited to be here and to serve as your lead policy analyst for this committee this interim. As nonpartisan staff of the Legislative Council Bureau, I can neither advocate for nor oppose any of the proposals that come before you. My role is to assist the committee as a whole and each of you as individual legislators while also providing policy and research needs to help you make informed decisions about the issues reviewed and studied by the committee. Before you or online on the legislative website, you will find the committee brief, which is also available via the legislative website. The committee brief provides a general overview of the committee, and I will briefly go over the committee brief with you. The history of the committee: the 2009 legislature created the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs with the passage of Assembly Bill 9. This committee predates the Joint Interim Standing Committees created by AB 443 of the 2021 session. The general powers of the committee are set forth in the Nevada Revised Statutes 218E.760. The committee is charged with reviewing, studying, and commenting on issues related to senior citizens, veterans, and adults with special needs. These general powers can be found outlined in the committee brief. In addition to these general powers, certain statutory reports from the Purchasing Division and the State Public Works Division of the Department of Administration are submitted to the committee. These divisions are required to report every 6 months to the legislature on the number and dollar amount of certain contracts awarded to local businesses that are owned by service-disabled veterans. Past reports are available on the website of the Research Division, and I will be happy to provide links to anyone who is interested. As for the committee BDRs from last interim, the past committee actions, you can find that on page 2 of the committee brief, and as well as the status, whether they passed or they failed. As for the future meetings, Chair Spearman has scheduled the first 2 meetings of the interim, with the next meeting being scheduled for March 26th. The committee has been allocated funds to meet 4 times during the interim, and a work session may be conducted on the last committee meeting. Finally, you will find a list of our committee staff and their contact information in the committee brief. As I mentioned in the beginning, all committee staff are available to assist the committee members on any issues related to the matters before the committee. In addition, the employees of the Research Division are available to provide information and assistance on a confidential basis to individual members of the legislature on any topic. Chair Spearman, thank you, and I'm happy to serve with you.
Thank you so much. Committee members, any questions? Comments up north? Okay. Thank you so much, Ms. Cooper. Agenda item number 4, presentation on the programs and services provided by the Aging and Disability Services Division of the Department of Health and Human Services. And I believe we have someone up north. The department's Deputy Administrator, Julia Peak, will provide an overview of the department. Ms. Peak, please begin when you are ready. Thank you.
Good morning. So this is actually Jessica Adams, Deputy Administrator with the Aging and Disability Services Division. And we actually have our presentation for items 4 and 5 combined into one PowerPoint presentation. So Chair Spearman, would you like us to stop after the slides for 4 and then take questions and then go into 5 after that? Or do you want us just to present all the way through?
Why don't we stop after 4, just in case there may be a lot of questions, okay?
Sounds good. So good morning. Once again, I'm Jessica Adams, and I serve as one of the Deputy Administrators with Aging and Disability Services Division. With me today, to my left is Jeff Duncan, one of our agency managers, and to my right is Cheyenne Pasquale, our planning chief. Our agenda today, we will just be, for the first part, we'll be going over our general ADSD program overview and our No Wrong Door project. And then the second part of the presentation, which is agenda item 5, is our snapshot on the demographics of seniors and people with disabilities in the state of Nevada. So ADSD's mission, and I'm not going to read this slide in full, but our vision is that Nevadans, regardless of age or ability, will enjoy a meaningful life led with dignity and self-determination. So we have a variety of programs that you're going to hear. We do serve the lifespan from birth to death throughout various programs within our agency, with the goal of having people live in a community-based setting in a dignified manner. First is our children's programs. So there are two programs within ADSD that are focused solely on children. Our Autism Treatment Assistance Program, or ATAP. This serves individuals or youth and kids that are on the autism spectrum disorder. It can serve through the age of 19, so anybody under the age of 20. This service does not provide direct services, but it rather pays for various services. So it can help pay for, most commonly, it pays for, I'm blanking right now. Sorry, trying to think of what the acronym actually is named. Applied Behavioral Analysis, that's the whole word for ABA. So it mostly pays for ABA services. It can pay for insurance copays, or it can also pay for the actual service if the child does not have any insurance that covers that. The main service given by the ATAP program itself, as far as state staff, is service coordination, helping families and youth access the various services that they need to help them with their autism spectrum disorder. The other children's program is Nevada Early Intervention Services, or NEIS. This serves young children from 0 to 3 with any sort of eligible diagnosis of a disability or a developmental delay. The focus of these services are that the services are given in their natural environments. So that could be home settings, play groups, community settings, and a variety of services. In this case, our state staff actually do provide quite a lot of the actual direct services with the goal of trying to bridge any gap and any delays that youth or that child may be having so that they don't need our services after they turn 3. The next slide is developmental services. So developmental services serves any individual from birth to death with an intellectual or developmental disability. We have 3 regional centers in the state that do these services. Sierra Regional Center is up here serving Washoe County. Desert Regional Center serves urban Clark County. And then we have Rural Regional Center that has 8 offices across the state servicing all of the rest of the state. Overall, we have about 8,100 people that we're servicing across the whole state at this point. Kind of similar to the ATAP program, there's not a ton of direct services that our state staff actually give. The main core service within the state staff is service coordination. We do have small clinical teams, so there are some psychologists and some nurses that can give direct services. Otherwise, the bulk of our services are contracted out to various providers across the state. And we have services like residential supported living arrangements, services that help people during the day that we call jobs and day training, behavioral consultation, nutritional counseling, counseling services, a pretty broad array of services that are mostly provided through a home and community-based waiver for individuals with intellectual and developmental disabilities. Within developmental services, we also operate the only state-run intermediate care facility, or ICF. This is down in our Las Vegas DRC location. It's licensed for 48 beds. And this is really a 24-hour institutional level of care for individuals with intellectual or developmental disability with a focus on active habilitative treatment so that we can promote functional skills and increase their independence and hopefully get them back out into a community setting. Now I will turn it over to Jeff.
Thank you, Jessica. This is Jeff Duncan for the record. Did you want to talk about your Day of Love shout out before we go on?
Excuse me, I forgot. My Valentine shout out is to my husband, Tom. We've been married for 25 years and our 2 adult sons.
This is Jeff Duncan. I just didn't want her to miss out on that opportunity, and I'll take mine now as well. My shout out would go to my 2 puppies, Alan and Jolene, but really to my mother, Vicki, because we lost, I said I wasn't gonna get emotional. This will be more nervous than the testimony. We lost my dad on this day several years ago, so thinking of him as well today. So the first slide I'm going to cover with you today is the Office of Community Living. That is my team. Very proud of this team. But in and I could talk about this all day, but for sake of time, we're going to stick to the script and be happy to come back to the committee and present further details. But we provide services and funding for various in-home services through, I'm going to talk about grants, through direct service within our agency, with the ultimate goal of to prevent or delay institutionalization. So the first team that I'll break down is our, let's call it our eligibility team. Part of this is our eligibility team for the Medicaid home and community-based waiver, the frail, elderly, and physically disabled waiver. And then we have another programs that kind of piggyback off of that are state funded. But I want to take this opportunity to make sure that I highlight the teams as well, because we always talk about the services and sometimes we don't talk about the people that are working behind the scenes. So everybody from our administrative assistants to our adult rights specialists, to our case managers, to our social workers, to our supervisors, everybody, they do a fabulous job with the ongoing vacancy issues we've been facing, and I wanted to make sure I make note of them today. The next lane that I'll cover is our supportive services. This is the actual case management within those two programs I mentioned in that first bullet. This is made up of healthcare coordinators, social workers, administrative assistants, et cetera, and then they make referrals out to Medicaid providers for in-home services as well, and that's a wide variety. And lastly, underneath that team is our communication access services program, where we have various programs and services for people who are deaf, hard of hearing, and speech impaired. Next, I'll cover community services. This would be a day-long presentation, so I'll just say it like this. We, in this team, provide millions of dollars to community partners across the state who operate community-based services. This is all done via subawards. We have 17 different programs or service areas underneath this lane, but the majority of the work is clearly done through our community partners, which is our nonprofits, counties, et cetera. So again, taking this opportunity to say thanks for them for not just getting us through the pandemic, but everything they do to continue to do on a daily basis. And then huge shout out to our team as well, the program coordinators, supervisors that make this happen on a daily basis. Last but not least, under my team is the planning team, and that's Ms. Pasquale, who you'll hear from in just a second. She is the chief over that, but they oversee our strategic planning, including our community engagement and our support for our advisory bodies. This is a small but mighty team, and you're going to hear a lot more about the core function of this team around door efforts. And the last thing I want to mention underneath Cheyenne's team is that we have a robust reports team that does a great job of all the behind the scenes things that we put out to the public. Excellent. And I'm going to come back to this slide. So now I want to talk about our protection and advocacy programs. The first one is our attorney of the rights for older adults, persons with physical disabilities, intellectual or related condition. But in short, this currently is vacant, but we hope to make an offer soon. But this individual provides technical assistance, education, training, as the slide says, but they also direct our legislative and regulatory policy advocacy for the division. So we're very much looking forward to this position getting filled. The next one on this slide is our adult protective services. This team investigates reports for vulnerable adults 18 to 59, and then also individuals over the age or 60 and older. But they not just investigate the allegations listed there on your bullet, but they also assist with services when that individual is made, it enters our program. A huge shout out to this team, which I'll highlight on the vacancy slide here in a couple slides. They've faced some major vacancies for a very long time now. The last slide I'll cover today is the rest of our protection and advocacy programs. The first one I'll cover is our long-term care ombudsman program, who advocates for residents in long-term care facilities, and they conduct investigations using person-centered advocacy. So they go into the long-term care facility based on a complaint from the resident, from a loved one, and then they are really the person-centered advocate on their behalf. But they also do unannounced site visits to these long-term care facilities as well. And last but not least is our small but mighty Office of Consumer Health Assistance. They assist consumers with understanding their rights and responsibilities underneath various healthcare plans. And I want to make sure this last point and then provide information to Ms. Mitchell, who provided public comment today. But they provide arbitrations to resolve disputes between out-of-network healthcare providers and health plans. So I want to take this opportunity to provide that phone number for anybody listening and Ms. Mitchell, who provided public comment. And the number I was given is 702-486-3537. That's right. Okay. 702-486-3537. Oh, did you say 87? Let me make sure I correct that for the record. 702-486-3587. Thank you for letting me clarify that for the record. Okay, then we'll go back to that slide. Thank you, Cheyenne. Lastly, just to show you all that we're not unique to any other state agencies. We've been facing major vacancy rates. Luckily, we've had some successes recently of getting some people hired, but we still have a wide variety of vacancies across the agency, and that just breaks that down. The majority for the teams that have the largest vacancy rate are social workers, which continues to be an ongoing challenge for our division. And Jessica and I will pause there to answer any questions you have before we go on to the next part of the presentation.
Thank you. Committee members, questions or comments? Vice Chair?
Thank you, Madam Chair. Thank you so much for that presentation, Ms. Adams, Mr. Duncan, Ms. Pasquale, for being here. Really appreciate the data. You knew I was going to have a question. So my first question on developmental services is you talked about Desert Regional Intermediate Care Facility, and while we're licensed for 48 beds, I'm curious to know, are we currently at capacity or do we have less than 48 people in that facility?
Good morning, Jessica Adams. I believe right now we are standing around 40 to 41 individuals living at that facility. The reason is we actually have one home that is down, and we've had homes rotating down for quite a while now as each home undergoes ADA renovations. So I believe we are just starting the home that is second to last. So this has taken a very long time. We've been going through this process now for, I want to say, about 8 years. So hopefully we will be done in the next couple of years with all of these homes finally being renovated, and we'll be able to be back open to 48 beds.
Thank you. My next question is relative to the division staffing and vacancies. There are two areas here that are in the 40th percentile. There's 47% vacancy rate for the home and community-based services and a 44% vacancy rate for adult protective services and the long-term care ombudsman. I'm curious to know, are those vacancies for a specific job description, or is it broad? Can you narrow that data just a little bit?
Thank you for the question. This is Jeff Duncan for the record. In the home and community-based services, that would be the social workers that I mentioned earlier. And then for the adult protective services would also be social workers. Then the long-term care ombudsman vacancy rate, I believe they are adult rights specialist. Wait for somebody to affirm. Thank you. So that would be the classifications that is causing those vacancies.
Thank you, Mr. Duncan. Chair, I have one more question, if that's all right. Thank you so much. On page 9 in the protection and advocacy programs that you talked about, I just want to be really clear that the long-term care ombudsman, is that for all of our Nevada residents and not specific to people who are enrolled in ADST programs or receiving Medicaid services? Will you clarify?
This is Jeff Duncan for the record. You are correct. It is for anybody residing in those long-term care facilities.
Thank you very much. Thank you, Chair.
Thank you. Anyone else in Las Vegas? Assemblyman Gray?
Thank you, Madam Chair. Actually, your co-chair verbatim asked my question, but I do have a follow-on because I can't imagine that that the number of beds at the ICF would begin to even touch the need that we've got in the state. Do we contract with any private facilities or private homes to provide these same services?
Jessica Adams for the record. So there are two private ICF, or actually three private ICF providers in the state. However, the bulk of services that happen in residential services happen through our home and community-based waiver. So we have hundreds of homes across the state serving, I would have to get back to you with the exact number, but again, thousands of individuals in residential settings. The ICF is the highest level of care. That's an institutional level setting. So the vast majority of people in our services do not need that level of care.
Madam Chair, quick follow-on.
Yes, please.
So if that's the case, I mean, there was 48 beds. Yeah, 48 beds. Is that going to meet the need? I mean, for that level of care in the state?
Jessica Adams for the record. I mean, this is a kind of constant conversation. Do we need to bring in some more ICF beds? I think overall within the state, we have between the private ICF beds and our state beds, we are close to about 100 beds, maybe in the state, a little bit less. The federal government for a very long time has tried to push away from institutional level of care. And so really what we've been focused on within developmental services is more how do we provide some of the more intensive services in a home and community-based setting, as opposed to like an institutional setting where doors are locked and people don't have like free access to everything. So is it enough beds? I don't really have an answer to that, but we are doing other things to try to, for those folks that are kind of teetering between needing an institutional level of care and making it home and community-based services, can we bring in some of those higher level services in a home and community-based setting?
Thank you.
Any additional questions? Comments? Yeah, I just have a couple. And let me start with the waivers first. I know, I guess it was maybe about 2 sessions ago, there were some things that were brought to our attention with respect to how some of the homes, the disrepair, and some of the ways that the staff were not complying with regulations. What must a home or a organization do that is running a home? What must they do to get a waiver? What constitutes grounds for a waiver?
Jessica Adams for the record. So the waiver is an actual funding mechanism for the services. The settings in which those services are given depends on the waiver. So I can speak to our home and community-based waiver for individuals with intellectual disabilities because ADSD actually certifies all of those providers of that service. For the other two waivers, for the physical disability waiver and the frail elderly waiver, it's actually healthcare quality and compliance with the Division of Public and Behavioral Health that certifies those providers, so they would have to answer for those settings. For our settings in the ID waiver, again, all of our providers are licensed, certified through Aging and Disability Services. It's a very extensive application process. They are certified then for anywhere from 1 to 3 years, depending on how well they do and the grade that they get on that certification. If they're a residential provider, every home that they open not only has to go through an environmental audit prior to them opening up the home by ADSD staff, but they have an annual audit by quality assurance staff. They have our service coordinators that are going in there every single month looking at the homes. So within our settings, we actually haven't had the same level of issues with the ID waiver that have been found in some of those audits. I think you might be talking about the audit that was for the community-based living arrangement homes under the mental health services, because that was a pretty bad audit several years ago. Like I said, luckily we haven't been in that path, but there's a lot of oversight for our providers to make sure that they are giving the services that we are contracting them to give.
Thank you. I'm going to go back and there's a number given for anyone who wanted to contact the Ombudsman. Can you just do that one more time, please?
My pleasure. This is Jeff Duncan for the record, and this is the number to the Office for Consumer Health Assistance, 702-486-3587.
Thank you. Someone was listening and didn't catch it. But anyway, so one of the things that I want to stress this too, one of the things that we did about 4 sessions ago, was to create enhanced penalties for anyone who was receiving maltreatment, who was over the age of 60. And I don't know what that translates to, and I'm looking here at the Adult Protective Services and Long-Term Ombudsman's 44% vacancy rate. Right now, do you have enough people to make sure that those who are perpetrators of that are brought to justice?
Thank you for your question. This is Jeff Duncan for the record. Unfortunately, I'm not the individual directly over that program, so I wouldn't be comfortable answering that. I can say this as far as the vacancy rate. It definitely heightens the amount of people that each social worker and team is responsible to investigate. So if I was to say this on their behalf, we would love to get our all of our vacancy rates addressed so we can continue to provide quality services to the individuals and not enhance or increase caseloads.
Thank you. One more thing. Nevada is one of the fastest growing graying states in the country, and I believe Southern Nevada is probably more indicative of that because of the climate, the tax situation, and I'm not sure, as I look at the staffing vacancies and some of the other things that were brought to our attention during this testimony, I'm not so sure that we are ready for that, meaning that by the year, I believe it's 2042, the population for those who are 55 and older will outnumber the population of those who are 54 and under. Is there anything that you all may be doing now that would help alleviate some of the stress as we grow more and more to that number?
So it's Jeff Duncan for the record. What I can speak to is that we continue to advocate in our budget request to address the ongoing demand. But the answer I can share today is that we're trying to do everything in our power in the interim to educate our interim committees and elected officials about our population, which you're going to hear more about the data, and I understand based on your agenda later on about that tsunami that is coming. So we do appreciate you continuing to bring that up and make sure that everyone is aware of what is coming.
Thank you. Last but not least, I'm looking at, are you all doing any crossovers with some of the other agencies that where seniors and those who are vulnerable adults, where they might encounter some type of maltreatment? I'm thinking specifically about maybe the Contractors Board, where people have an issue with someone who is taking advantage of them. Are you all doing any crosswalking with them? Or is it just with the homes? Is it just with those persons who are that you know about physically?
Good morning. I'm Carrie Embry for the record. Adult Protective Services has authority to do multidisciplinary team meetings. We call them MDTs. And the Contractor Board, we do have them participate in those meetings just for the reasons that you were describing, helping to educate, and the Contractor Board also for the teams that are at those meetings, educate what they can do in helping to protect the vulnerable adults.
What about the Medical Board?
The Medical Board, we do make referrals to the Medical Board. Adult Protective Services does when there's concerns for maltreatment. Also, the Office for Consumer Health Assistance also makes referrals to the Medical Board as necessary.
So I'm going to drill down a little bit further. We had the testimony during the comments during public testimony during public comment about a doctor. I believe there were some people that were involved that did not necessarily provide the necessary elements of proper protocol. And so it's one thing to refer something to the ME board, but if there is a complaint about someone who is a member of the ME board or the ME community, do you all have anyone that can pursue that investigation?
The Office for Consumer Health Assistance, as well as the Office for Consumer Health Assistance doesn't investigate the individual, but what the Office for Consumer Health Assistance does is work with the consumer regarding their concern and can assist the individual in making that referral to the medical board, or if they're unable to, the Office for Consumer Health Assistance can make that referral for them. But it's the medical board who investigates the medical healthcare provider.
Okay, thank you. And I'm just trying to make sure that we're clear, so those who have issues with those agencies where there needs to be crosswalk, they understand how they the procedures that they have to go through to make sure that happens. So thank you. I got one more question to ask. So the vacancy rate is, I think the lowest one here is what, 8%? If you had to identify two challenges to hiring and retention, what would those two challenges be?
This is Carrie Embry. The challenges that we face, one is just the competition or salaries, for example, with the social workers. Social workers can make more money in the private sector. Oftentimes the counties can pay more. So that is a constant competition, if you will, for the social workers. And the other thing with the social work vacancies is, quite simply, there's just not enough social workers within the state. And Aging and Disability Services Division works with the University of Nevada, Reno, the School of Social Work, and UNLV, and we collaborate together in working towards more social workers in the field. And so that would be the other challenge.
Thank you. So that collaboration include programs like I know we're doing for doctors, and I think there's one for nurses, kind of grow your own. So people who are enrolled in those programs, there are specific things that they might be able to do that would reduce either their expenses after school, or some type of incentive for them to stay in Nevada.
I'm not aware of those types of incentives for social workers. Some of the things that we've done is use grant money to help social workers earn a salary while they're doing their field practicum. So we have done that. That's one of the things, but in relation to what the physicians and nurses do and the incentives in that regard, I'm not aware of that exact incentive for social workers.
Okay, last question, and I think this is really the last question. So we have compacts with several other professional boards and agencies. So is there any way to perhaps look at what those who are either in the military and exiting, or military spouses who fall in line or fall under the rubric of licensed social worker, is there anything that we're doing to maybe do outreach, to maybe try to identify those who may be coming in or those who are here already, so that might help alleviate the problem?
That is excellent, Senator Spearman, idea. What we are doing currently is we do work with the veterans, particularly with their field practicums, hiring them. That is a priority for us, but with the compact, no. Be interested in looking at that.
Yeah, thank you, because I think that has helped in a lot of instances where there's been a shortage of professionals. And I'm not sure, I know that we worked with a couple of other professional boards related to the compact last session, but that's certainly one way to look at how you might be able to reduce the number of vacancies. So, just saying.
Yes, thank you.
Committee members, additional questions or comments? Okay, so now let's go to agenda item number 5, demographics on senior citizens in Nevada.
Good morning, Cheyenne Pasquale, Planning Chief for the record.
Wait, just a minute, just before you proceed, Madam Secretary, please mark Assemblyman De Silva present. Okay, let's go.
Before we jump into the data, I'm going to talk a little bit about Nevada Care Connection and our state's No Wrong Door efforts. When we talk about No Wrong Door, we're really talking about supporting people and making informed choices around their long-term service and support options. To Senator Spearman's point, we recognize that long-term services and supports don't happen in a vacuum, and there's several other needs and systems that impact our populations. And to that point, we are currently participating in a learning collaborative to explore developing a multi-sector plan on aging, which is a tool that many states across the nation have used to help elevate issues related to aging and older adults. So more to come on that in a future presentation. But in terms of No Wrong Door, there's really 4 key elements that we look at. And these 4 key elements have been defined by the Administration for Community Living based on best practices. The 4 key elements are state governance and administration, so ensuring that multiple agencies involved in long-term services and supports are coordinating efforts and coordinating policy making, and also being responsive to the changing needs of the community, so the quality assurance and continuous improvement. Second is public outreach in coordination with key referral sources. So ensuring that people know where to go for assistance and information. Third is person-centered counseling, what we call in Nevada resource and service navigation, helping individuals explore all of their long-term service and support options, not just our public programs. This could include veterans benefits, informal supports, and private pay options. And then streamlined eligibility. For those individuals that are seeking public programs, it's ensuring that we are making efforts to streamline that eligibility process and make it as easy as possible to access those services. So when we look at our current efforts, we have a lot going on. In terms of public outreach and linkage with key referral sources, ADSD is currently working with a vendor to help rebrand our agency and promote our programs and services to the populations that need these services. You should see a new and improved ADSD website as well as outreach materials by the end of this year. We're quite excited about that. We also utilize the Nevada 211 service as our 800 number for accessing health and human services, and are looking at various avenues to promote Nevada Care Connection and increase people's awareness of our resource and service navigation. In terms of person-centered counseling, this is where efforts have really focused over the last several years. And this is our resource and service navigation, and really looking to increase our capacity for navigation. Currently, we have about 29 navigators across the state, and these are in our established aging and disability resource centers. And we are looking at developing some training and really a certification program to professionalize the resource and service navigation. We also are looking to beginning a project to develop specialized training for specific populations. When we look at streamlined eligibility determinations, we're working closely with the Division of Welfare and Supportive Services on a No Wrong Door IT project, which will facilitate applications and referrals into DHHS programs across all of the divisions. The Division of Welfare and Supportive Services is also working with ADSD and the Division of Healthcare Financing and Policy on an eligibility engine project, which will help streamline the eligibility process for our waivers and other Medicaid programs. And then last but not least, we are looking at modernizing our case management systems to improve our data collection and streamline some of our processes. Finally, we have a federal grant to develop an implementation plan and the governance structure for No Wrong Door. We have completed a mapping of our existing access points with some recommendations from our facilitator, and we are now moving into the planning phase to strengthen efforts in each pillar for our continuation plan. As one example of our efforts, we wanted to highlight our resource and navigation pilot that we're doing in coordination with Adult Protective Services. So the goal of this pilot is to support individuals to ensure that they are connected to referrals made by the Adult Protective Services program and work to develop long-term care plans to minimize future risks, really looking at reducing the recidivism in Adult Protective Services. Currently, this pilot is scheduled to end in September of this year based on our federal funding. We've served 192 people to date. And some of the lessons learned are that there are individuals that have very complex needs impacting their health and well-being, that these needs cross multiple domains and go beyond social determinants of health. But this interim support has helped to reduce that recidivism into the Adult Protective Services system. And so we are actively working with Adult Protective Services and our agency to look at mechanisms to continue this intensive support. With that, I will move into some demographics. These next 4 slides highlight Nevada's growth in population as compared to the U.S. for both people with disabilities as well as older adults. This data comes from the U.S. Census Bureau, the American Community Survey, and was inspired by the very first chart that you would see in the Elders Count report. This data shows the change in populations over a 10-year period from 2012 to 2022. Starting with children with disabilities, you can see in this slide that our population of children with disabilities has increased dramatically as compared to the U.S. population increase in this same time period. Important to note is that the children with self-care difficulties is 31% growth in just a 10-year period. I would also like to note that the way the census data works, individuals may experience more than one type of disability and therefore could be represented in more than one disability type. As we move into adults with disabilities, again, our population has grown exponentially across disability types as compared to the U.S. And once again, I would like to draw your attention to the self-care difficulty. 37% increase in our Nevada population as compared to a 10% increase in the U.S. population overall. This not only signals a higher potential demand for long-term services and support, but also forecasts potential expenditure increases, which we'll discuss further on slide 18. This slide highlights Nevada's growth in the older adult age groups, regardless of disability status, and I believe this is figure 1 in the Elders Count report. It's updated from what's in the Elders Count report. As already noted, Nevada is aging faster and at faster rates than the U.S. You can see in this slide the age 75 and older population is almost twice the growth rate of the U.S. population. A couple of things to note about older adults. From the Elders Count report, we also know that the rate of falls triples from the age 55 to 64 to the age 75 to 84. And as people age, the consequences of falls, including the death rate, increases significantly. Additionally, from the Elders Count report, we know that our older population is disproportionately overweight or obese. Approximately 70% of our older adult population is overweight or obese. And being obese leads to higher rates of diabetes, heart disease, and other medical issues. I pulled out the data regarding independent living difficulty from the American Community Survey as a separate slide. Because we can see in Nevada that our population has grown more than 3 times that of the U.S. across individuals that have an independent living difficulty. This means that not only do we have more adults needing independent living services, but we have not yet seen the impact that this will have as individuals age. You might ask yourself, why is this important? The Medicare-Medicaid dual eligible population is the most expensive population in our healthcare system, constituting 59.6% of expenditures in fiscal year 20, and that's across the nation. Additionally, this population is largely made up of individuals age 65 and older. Nevada needs to ensure we are not only supporting the health and social needs of people with disabilities, but also needs to consider a cross-sector master plan to support healthy aging of all Nevadans, because, as I like to say, every body is aging. Thank you.
So this is Jeff Duncan for the record. Thank you, Cheyenne, for that snapshot on there. Before we open it up for questions, I just want to say that we've now provided you a very high-level overview of Age and Disability Services Division. Talked a little bit about the pillars of No Wrong Door, and then Cheyenne just briefly touched on the data. So we know that what we do is great. We have fabulous team members, wonderful community partners and providers, but we're still sometimes the best well-known secret out there. We don't want to be a secret any longer. So based on your former feedback, we've done some concentrated efforts around outreach. So in response to that feedback, we've expanded our outreach efforts, including to many target populations. And so since February of 2023, our various team members have hosted or attended over 201 events out in the community to talk about what we do or what might be available to them. And this includes groups such as veterans, the LGBTQI+, and tribal events. So we'll continue to work on this so we're not the best known secret, and track our data so we can continue to diversify where we're targeting and expand our outreach efforts to hopefully help people know what we do and what the array of services that we offer. And so now we'll pause and stand for any questions you all might have about our entire presentation. Thank you.
Thank you. Committee members, questions? Yeah, Vice Chair.
Thank you, Chair. Thank you so much for that really great overview relative to where we are. I have only 2 questions for you at this point. With regard to the No Wrong Door key elements, I'm curious to know, have you engaged the contractors, the provider network that you all are engaged with to assist? Are you providing them training to help you with that No Wrong Door point of entry in order to get referrals?
Thank you, Cheyenne Pasquale for the record. We do engage with our network, and as we go through this planning phase, we are really looking at increasing that engagement to not only work more closely with the identified natural access points, but also ensure that we're working in a coordinated effort.
Thank you, Ms. Pasquale. I appreciate that. And then my next question is really specific to the percentage increase to 75 and over that you presented on page 17 of your PowerPoint. If we know that our folks are aging so significantly and our growth in that area in particular is so significant, I'm curious to know, where do we stand with regard to the implementation for the caregiver assessment? How are we identifying where those folks are? Can you just give us a quick update? I believe Mr. Duncan was working on that previously, so whoever can answer is appreciated.
Thank you. We are looking at implementation. It's AB 100, I believe, for the caregiver assessment. We have looked at several assessments across multiple states, and we are getting ready to launch a work group to sort of narrow down what would be the best assessment to implement in Nevada and where is the best places to pilot that assessment. So.
And this is Jeff Duncan. That was Cheyenne Pasquale for the record, because I would not have been that savvy in my response, so thank you.
Las Vegas, any additional questions? Assemblyman Gray?
Yes, Madam Chair, of course I do. Thank you. Question. You know, we are outstripping the U.S. in every single category. Now, is that because our actual population is getting older here, or are we getting an influx of older population into the state, or is it a huge combination of both?
Cheyenne Pasquale for the record. It is a combination of both.
Thank you.
Anyone else up north? Senator Krasner, I'm sorry, I'll get used to it in a minute. Senator Krasner?
No, nothing.
Thank you. So I've got a couple, and let me start on the heels of what Assemblyman Gray just asked. So I believe it was 2017, we had a bill that required the Veteran Services, Department of Veteran Services to establish an outreach coordinator for veterans who were discharged under Don't Ask, Don't Tell, DADT, many of whom got dishonorable discharge, other than honorable, or under other than honorable conditions, which made them ineligible for many of their veterans' benefits. So here's my question. Are we doing any crosswalking? Because I know that there are a number of older adults who, before we became more enlightened, their families kicked them out. They had no recourse, no place to go, and so they don't have families by birth, they have families by choice. And so I'm wondering if this age, because I do know a number of people, the age of 65 and older, who in the LGBTQ community, were it not for the bad DD 214, they would have access to many of the veteran services that I do, but they don't. So what is the relationship with you all and the Department of Veteran Services? Because I do know that there was, by law, the requirement was for them to establish that person, and I would venture to say that that person should probably be working very closely with you all, given the stats that we're looking here, 60 and over, 65 and older, and 75 and older.
Cheyenne Pasquale for the record. There are two efforts that come to mind. First, through our Nevada Care Connection, we are partnered with the VA administration to administer a self-directed veterans home and community-based service program. Secondly, we are in the final year of our current state plan on aging, and so we are beginning efforts next month to update that state plan on aging, and this is federally mandated. And one of the areas of focus for us in our next state plan on aging is the LGBTQ plus community. We're working with SAGE, and I'm drawing a blank on the Nevada organization, but we're working closely with two organizations that will help us to connect with those populations and ensure that our state plan on aging can address the needs of that population.
Is that Silver State Equality?
Yes, thank you. Cheyenne, for
Okay.
the record.
So I want to be a little bit more pointed. That's good, but there are veterans who are in that age group of 60 plus who received dishonorable, other than honorable, discharges. And the bill in 2017 was specifically to have the Department of Veteran Services develop or have a person who would do the outreach to veterans who may have what we call bad paper, so that they could get those discharges upgraded. Now, I appreciate what you're doing with SAGE and with Silver State Equality, but I'm looking more specifically at those veterans, many of whom are in that 60-plus age. And I know that Dr. Carter, with helping our brothers and sisters out, has introduced me to several people who I personally introduced them to attorneys that would help them get their discharges upgraded. Because the Veteran Services, the VA, will not touch someone that has less than an honorable discharge. And so if it was just for DADT, don't ask, don't tell, then there are provisions in the law for them to have that upgraded. And so some of the services that you all are trying to provide and you may have limited funding for, if we reach that group of people, then they can have services provided for them or to them via the VA. They just need their DD-214 upgraded.
So this is Jeff Nugget for the record. Senator Spearman, we appreciate that overview. We are not familiar with that contact, but we'd be happy to work with them. Many of our programs, regardless of your veteran status or it doesn't matter about your income, you're eligible for our community services. So we would always serve somebody who is 60 plus regardless of that, but we'd be happy to coordinate with them if you can provide us with contact information.
I will do that. I believe the person down south is over at the VA hospital. But again, I say someone who was discharged, and that was the whole purpose of the Veteran Services Commission, providing that person, a contact. So you may want to contact Veteran Service Commission and find out who that person is. And it's been brought to my attention that the program may not be as robust as it should be. But given the statistics that I'm looking at, and the more that those statistics, the numbers increase, there's a correlation between the increase in those numbers and the decrease in budget or funding. And so identifying those persons and making sure that they get their discharge upgraded then puts them in a different category, and the money that you save from those veterans who now are eligible for the VA services can be applied to those who are not veterans. Does that make sense to you?
Jeff Nugget for the record. Yes, it does. Thank you.
Next thing I want to look at, we didn't talk about suicide. Because I think it was last year, I think I read a report that in Nevada is either number 1 or number 2 in senior suicide in the nation. So what are we doing? And a lot of that has to do with being disconnected. The more people who move here because of climate and tax and the ability to stretch their retirement, the more people that do that, the more disconnected they are from their families. Someone who moves here from Cleveland, especially during the winter, they are disconnected from their family for various and sundry reasons. And so if we're not doing anything that does outreach through other community organizations, and I'm thinking specifically now about faith-based organizations and maybe AARP, and they'll probably talk about that a little bit later, AARP, but some of those agencies or some of those community organizations that could help buffer, if you will, some of the loneliness, the disconnectedness, and the depression that comes along with that. So what are we doing to make sure that we are doing a comprehensive outreach? And please do not hear this as castigation or ignoring what you've already said. I'm just trying to make sure that we're doing everything that we possibly can. Something that has never been disproved, theory of mine, if you don't die young, you're going to get old. So what are we doing in terms of outreach for that?
So it's Jeff Dunk for the record. Is it everybody is aging? Is that what we're going with? Yes, we agree with you there. As far as the suicide, we do provide training to our team members, to our community partners, and they are well-trained and skilled to make the appropriate referrals. As far as us leading any specific suicide initiatives, I can't think of anything off the top of my head other than we coordinate with public and behavioral health whenever these opportunities come up, but we definitely make sure that our social workers are aware of the signs and make the appropriate referrals to behavioral health providers.
Thank you. Any additional questions? Anyone? I think that's probably the last one I had was Alzheimer's and dementia. Recognizing that the onset may be earlier than 60, are there any coordinated efforts to make sure that we're identifying that group or that population so that we might prepare as we move forward? Because if someone has the onset of Alzheimer's or dementia at 55, they may not present to Aging and Disability Services.
Thank you for the question. This is Jeff Duncan for the record. This will be a two-part response. I'll speak to our state funding that we do now have funding for those 55 plus that would be eligible for some of our service if they're diagnosed with dementia. And then I'm going to have Cheyenne speak briefly, because this could go all day, on a grant opportunity that we have.
Cheyenne Pasquale for the record. We currently have a federal grant to increase our outreach and support to individuals with Alzheimer's or dementia or who are showing signs of cognitive impairment. So we are looking at establishing a pilot program, which is called Dementia Care Specialist. It's replicated after a model that was implemented in Wisconsin. And these dementia care specialists will work with individuals in crisis to help stabilize them. They will also provide memory screening as well as outreach and assistance on Nevada's dementia toolbox. And we are working with the Division of Public and Behavioral Health under their BOLD grant to coordinate efforts.
Thank you. Are you also working and coordinating with Ruvo Center downtown? They're part of the Cleveland Clinic, because I know that Dr. Wendt et al. Are doing a number of things too. And I mention this because if you're doing the same thing, perhaps there's a way to collaborate so that you can stretch your money a lot further.
This is Cheyenne Pasquale for the record. We have several partners in addition to the Cleveland Clinic, Ruvo Center. We are also working with the Alzheimer's Association and the Dementia Education Engagement Research Center at UNR.
Thank you. Additional questions, comments up north? Okay. Thank you all so much. I appreciate the presentation. It was very thorough, and I'd like to speak a little bit more offline with some of the questions that I had with respect to DD 214 upgrades, because I've been contacted by some veterans who had no idea where to go, and that disturbs me. So if you all can, I'll have Ms. Cooper to set up a time that we might be able to meet, okay?
It's Jeff Duncan for the record. Looking forward to it. Thank you.
Thank you. Thank you. And with that, we will move to agenda item number 6, presentation of reports related to the efforts to address disparities in healthcare and behavioral health due to race, color, ancestry, national origin, disability, familial status, et cetera, language or income level of persons required. And you'll see here an NRS quoted, but I'd also like to establish for the record that in 2022, we did pass a constitutional amendment that requires people to be treated fairly without discrimination, and if that does not happen, then that is a violation of their constitutional rights, not just a statutory infringement, but it's a violation of their constitutional right here in Nevada. Okay? Thank you. Ms. Neal, proceed.
Thank you. Good morning, Chair and members of the Committee on Senior Citizens, Veterans, and Adults with Special Needs. I am Alexandra Neal, a Minority Health and Equity Specialist with the Nevada Office of Minority Health and Equity. I will be co-presenting on the topic of equitably proportionate distribution of funding required by Senate Bill 341 from the 81st Legislative Session in 2021 with Julia Peak, one of the Deputy Administrators for the Division of Public and Behavioral Health. During today's presentation, we will briefly introduce the Nevada Office of Minority Health and Equity and the Division of Public and Behavioral Health, review Senate 341 components codified in NRS 429.259 and NRS 433.359, provide a brief overview of DHHS block grants, addressing disparities in healthcare and health outcomes on categories of persons listed in NRS 439.259 subsection 3. Provide a brief overview of DHHS block grants, addressing disparities in behavioral health care and behavioral health outcomes on categories of persons listed in NRS 439.259 subsection 3. And briefly touch on American Rescue Plan Act funding. The Nevada Office of Minority Health and Equity, also known as NOMI, is located within the Director's Suite of the Department of Health and Human Services. In 2021, NOMI worked with Chair Spearman to provide equitable input into her Senate Bill 341. As previously mentioned, the Department of Health, the Division of Public and Behavioral Health, also known as DPBH, one of the 5 divisions within the Department of Health and Human Services, will assist with the presentation on efforts to address disparities in healthcare and behavioral health. Both DPBH and NOMI work to embed health equity principles in our work, and we are looking forward to sharing the information requested today. Senate Bill 341 contained multiple components. 2 components codified the requirements for reporting on efforts to address disparities in healthcare and behavioral health. NRS 439.259 authorizes the Division of Public and Behavioral Health to apply for grants for addressing disparities in healthcare and health outcomes based on race, color, ancestry, national origin, disability, familial status, sex, sexual orientation, gender identity or expression, immigration status, primary language, or income level. Where the extent is authorized by a grant, DPBH is authorized to use a competitive process to select and award a grant of money to a nonprofit organization to serve as a lead partner to ensure that the healthcare services supported are funded and allocated in an equitable manner. Where the extent is authorized by a grant, DPBH can also establish and consult with an advisory committee to ensure the healthcare services supported by a grant are provided in a culturally competent manner. NRS 439.259 also requires that the Department of Health and Human Services completes a report that includes the amount of money allocated by the department during the immediately preceding calendar year to support the provision of healthcare services or other services to promote physical well-being in communities with higher risk of health problems, decreased access to or usage of healthcare services, or worse health outcomes, or physical well-being than the general population based on race, color, ancestry, national origin, disability, familial status, sex, sexual orientation, gender identity or expression, immigration status, primary language, or income level. This report should also include a description of services provided and the efforts made to locate persons in need of such services and the numbers of persons who received the services, as well as the demographics regarding them, including income level, age, race, and ethnicity of those persons. Similarly to NRS 439.259, NRS 433.359, also established by Senate Bill 341 in 2021, authorizes the Division of Public and Behavioral Health to apply for grants for addressing disparities in behavioral health care and behavioral health outcomes with the same demographic considerations and authorizations as those listed for the previous statute and those listed on the slide. NRS 433.259 also requires the Department of Health and Human Services to complete a report that includes the amount of money allocated by the department during the immediately preceding calendar year to support the provision of behavioral health services, review of service usage, and behavioral outcomes in the mirrored demographics mentioned in NRS 439.259. And as you can see, it is also on the slide. This report is to provide a description of services, efforts to locate persons in need, and the number of persons who receive the services. Now I will turn the presentation over to my co-presenter, Ms. Julia Peak. Julia?
Thank you, Ms. Neal, and excellent job. That was her first time presenting, and she did phenomenal. So hard act to follow. Thank you, Chair Spearman and members of the Committee on Senior Citizens, Veterans, and Adults with Special Needs. As was mentioned, my name is Julia Peak, and I serve as one of the Deputy Administrators for the Division of Public and Behavioral Health. I will be presenting on some of the grants today that are highlighted in the reports we've provided. They show our work in healthcare and health outcomes as required within the Director's Office and the Division of Public and Behavioral Health. Moving to slide 9. I wanted to note that we are just providing a subset of the programs that support the work in addressing health disparities at our agency. Our categorical and block grants are intended to identify the populations at most risk of certain health outcomes and develop strategies to prevent or intervene to improve those outcomes. Much of the work we do has disparity in one form or another as we review the data and develop interventions. I've provided our mission statement, but that was already provided, so moving on to slide 10. During COVID, Nevada had an influx of funding to support the prevention and intervention efforts for our public health programs. One substantial grant was focused on addressing the health disparities highlighted during the COVID response. This grant allowed Nevada to increase and improve data collection to identify disparities, then build the infrastructure to support the COVID prevention in those areas. This was most often done through our community partners. And I'll note that I'm joined today via Zoom by the leader of this work, Godwin Nwando. He is actually having military training right now, so he was kind of step away from that and join us. On slide 11, continuing on that same grant, this also created our Health Equity Unit within the Division of Public and Behavioral Health, and it's a great complement to the work that Ms. Neal and her colleagues do in the Director's Office for our state Office of Minority Health and Equity, and also our Minority Health and Equity Coalition that's housed out of UNLV. Moving on to slide 12, we wanted to share and highlight some of the work done under this grant. We have shared some specific projects and partners on this slide, and we've also prepared a more comprehensive, detailed report that we're happy to share with the committee. In addition to supporting the COVID response directly, and as you can see, we also provided funding to the community-based partners, and that includes our local health authorities and coalition who serve as the boots on the ground to lessen the impact of COVID for those they serve, but also to address some of the underlying comorbidities that we saw when COVID hit. That could be cancer, HIV, and other conditions. We also mobilize community health workers, which are an integral part of our public health response, both prevention and interventions. Moving on to slide 13, the next grant we wanted to highlight is our Maternal and Child Health Block Grant, otherwise known as Title V. This grant includes performance measures centered around equity across race, ethnicity, disability status, language access, insurance status, geography, gender, and more. This project has a foundation in using a health equity lens in our work, inclusive communication, and preferred terms. On slide 14, we highlight infant mortality data in Nevada versus the U.S. to highlight a focus of work under the Title V grant. Understanding infant and maternal mortality and identifying disparities and targeted interventions is a focus of this project, also a topic that's come in front of the legislature. Moving on to the next slide, this next graph depicts the maternal mortality in Nevada versus the United States. the Maternal Mortality Review Committee reviews this data to understand the disparities and possible interventions to reduce this burden. On slide 16, we wanted to share this illustration to show how our team is collecting and analyzing data to understand disparities related to maternal health and developing interventions to address the burden in those communities. I'll note that one of these interventions includes developing the Alliance for Innovation and Innovation on Maternal Health, also called AIM, and that focuses on addressing severe hypertension. Moving on to slide 17, I wanted to highlight the Preventative Health and Service, that is the title, two healths in there, block grant, but I'll call it PHHS. This project is designed to allow states to fill gaps in public health services that are not supported fully with other categorical grants or local projects. The work under this project must align with the Healthy People 2030 objectives, and there are noted objectives provided here on the slide that help align the work done in Nevada with our federal objectives. Like all grants, as we align specific activities with grant requirements, we address those Nevadans at most likelihood of experiencing that condition, disease, or outcome and try to intervene to get a better outcome. Slide 18 provides more details on what Nevada specifically uses our PHHS grant to accomplish. This work includes equity training and work with agency partners in this area. Moving on to slide 19, this provides an overview of our WIC program. This is one of the largest projects in DPBH fiscally and provides supplemental foods and nutrition education to low-income pregnant and breastfeeding women and their children up to the age of 5. As can be seen on the data dashboard for WIC, over 55% of our clients are Hispanic, followed by almost 20% that are white non-Hispanic, and 60% being Black non-Hispanic. On slide 20, we wanted to highlight another program for women in Nevada, the Women's Health Connection and Well Integrating Screening and Evaluation for Women Across the Nation. The acronyms for that are WHC and WISE Women. These projects provide screening supports for low-income women who do not have adequate health insurance. To date, we've served over 80,000 women in Nevada under these programs. Slide 21. This grant is managed by our director's office. It's called the Community Services Block Grant, and it supports a wide range of services, as you can see on the slide. Highlighting a couple, these are direct services who are considered, for Nevadans who are considered low income and underserved. This includes a focus on Nevadans with a disability and seniors. On slide 22, this is another project that's overseen out of our director's office. It's called the Social Services Block Grant, also known as Title 20. Title 20 is designed to support Nevadans achieve or maintain economic self-sufficiency to prevent, reduce, or eliminate dependency on social services. On slide 23, we wanted to highlight the work of the state's immunization program. This program does support every Nevadan. However, there are certain projects that provide specific support for children who are underserved or underinsured or insured by Medicaid, adults without insurance, and other efforts to promote vaccine awareness and points of access within underserved communities throughout the state. On slide 24, we wanted to highlight one of our newest projects, the Public Health Infrastructure Grant. This is a CDC grant, and we refer to it as FIG. Please note that the Southern Nevada Health District was directly funded by the CDC for this project, so I'm not going to highlight efforts done in Clark County because they're providing those services directly. The state portion of the grant did require a certain percentage to go to the local public health agencies, and those entities are noted here and some of the work that they're doing as well. I want to highlight that this funding stream will allow the Northern Nevada Public Health Department to continue some of the great equity work that they did with the prior grant I mentioned, the health disparities, as that will be ending. On slide 25, more on the FIG grant. This funding is also continuing to support our colleagues at the Nevada Office of Minority Health and Equity, as well as the Nevada Association of Counties, both incredible partners in COVID and public health generally. Lastly, I wanted to highlight under this grant that we're going to be hiring our first full-time cultural navigator, specifically designed to work with the tribal entities in the state. We do have tribal liaisons at every of the DHHS agencies. However, this position will be able to do that full-time now. On slide 26, I'm going to switch gears now and highlight some of the behavioral health projects that are looking to address disparities. On slide 27, we wanted to note how the Health Disparity Grant transferred some funds to our partners on the behavioral health side of the house, and one of the things that they were able to do is support resilience ambassadors, as well as the crisis support services and many other services as are presented on this slide. On slide 28, this next slide provides an overview of the Substance Use Prevention, Treatment, and Recovery Services Block Grant. This grant does fund targeted efforts for the LGBTQI+ community and Native American youth. There is also a focus on military and veteran outreach, pregnant women, and other Nevadans who use IV drugs. This also supports residential treatment services statewide. On slide 29, we wanted to share information about the State Opioid Response Grant, otherwise known as SOAR. SOAR works in various target populations. Some of note include faith-based organizations, peer groups, labor associations, tribal partners, and those experiencing homelessness. Moving on to slide 30, we wanted to outline that we're supporting a pilot grant to look at treatment for pregnant and postpartum women. This pilot project, my apologies, is focused in Washoe and Lyon counties and offers peer support and wraparound services. On slide 31, we wanted to highlight another one of our block grants called the Community Mental Health Services Block Grant. This block grant supports the Suicide and Crisis Lifeline 988, of which this has been presented many times in front of this body, the NAMI Warm Line, and the Pediatric Access Line. This project also supports services for those experiencing homelessness and those who may be justice involved. On slide 32, the PATH grant, that's also known as the Projects for Assistance in Transition from Homelessness, supports the connection between those experiencing homelessness with resources and housing navigation. Slide 33, again speaking to 988, this is the 988 Cooperative Agreement, and it works with numerous stakeholders, but we wanted to highlight the work with our tribal communities and assurance of culturally competent programs for veterans and LGBTQI+ clients. On slide 34, we did want to take some time to acknowledge some of the work done under ARPA and provide a thank you for all the projects that have been funded through the legislature with this funding. DHHS has had a total of 148 projects and initiatives funded. 45 projects are totally complete, which is 30% of the total. In total, DHHS has received more than $574 million for those 148 projects. I do want to highlight a couple that I've had the pleasure to work on at DPBH, one of which was working with Silver State Equality and Director Wade specifically in addressing the MPOX challenges that we were facing. That work still goes on through other funding streams. Also, one of the projects that the body has allowed us to work on has been workforce initiatives. We developed a website that I would love to get on record. It's called nvhealthforce.org, nvhealthforce.org. That's a project that we're working on to increase visibility of workforce pipelines for public health, behavioral health, and it also is going to highlight much of the opportunities for the public to get scholarships, clinical rotation dollars, et cetera, that were provided through ARPA to get more folks into the healthcare field. Moving off ARPA, slide 35, we wanted to provide our contact information if there's questions from the public. After, they can reach out to Ms. Neal and I. We're happy to answer those. Slide 36 provides a list of our acronyms. And then 37, I did want to mention much of the data that we use is provided through our Office of Analytics, and they've developed dashboards for many of our projects, and those can be viewed online through that link. With that, we are happy to take any questions that you may have, and we do have a number of subject matter experts here that can also help us with those questions. Thank you, Chair.
Thank you. Committee members, questions? Anyone up north? Come on, somebody. I can't be the only one asking questions here. I'm sitting up here reading everybody's mind, so it's coming into my visual space. So thank you, Ms. Peak, and thank you, Ms. Neal, and I would have expected nothing less than excellence based upon whose daughter you are. So I'll make sure that I tell your mom you've done her proud, okay? So I guess I have just one thing. In Senate Bill 341, I think it was Section 2. Section 2 and 17, there was a requirement for a report to go to the legislature in terms of how the program was doing. How were you addressing and how were you, what metrics are you using to make sure that the letter and the spirit of equity is followed in healthcare and distribution of funds?
Julia Peak for the record. I don't know if Ms. Neal wanted to provide comments or if I could jump right in.
Okay.
Alexandra Neal for the record. Two reports were submitted to the Legislative Council Bureau last week regarding the requirements from Section 2 and 17, which I believe is also codified in the NRS that we read. I will turn it over to Julia Peak to provide additional comments.
Perfect.
Thank you, Ms. Peak.
Yeah, my pleasure. Thank you, Ms. Neal. And Chair, we are apologetic for not providing the reports. We do have a lot of reports that we prepare for the legislature, and this was one that we were deficient on. We have now prepared those two reports and submitted them. We also prepared an additional report at the division that we're happy to provide as well that details out the work. Though we did not share through the report all the efforts we've been doing the last couple of years, I hope that you could see it's really embedded, and we will document this going forward. But certainly our apologies at the division, our apologies out of the director's office that we didn't provide that timely after the legislation was passed.
Thank you, because I think what that will do is, moving forward, it will help to see whether or not we are preparing for and beginning to address in advance the diversity that is taking place here in Nevada. Nevada is, in addition to graying, Nevada is beginning to look more and more like the entire American population. So that way, everyone in DHHS has a handle on not only where we are, but where we might be going. And I know that the director really wants to stay ahead of those sorts of things. So thank you much. The second thing is and I can't remember which slide it's on, but we talked about mental health. There is still acute trauma in many of the communities that suffered greatly during COVID. I still get calls from people who lost 3 people in family, 2 in the same generation and 1 in another generation. So is there anything that we're doing to help provide information and or assistance to people who are still dealing with the trauma? And some of the ARPA funds may have been allocated for that, but I'm just trying to get on the record. What are we doing now, and what are the plans for the future? Because not only were there adults, but there were still youth, young people, students, who are wrestling with that. And recently just learned that the school district here is looking at reducing the number of social workers and counselors that would address that. And so I want us to get out ahead of that. If that indeed is true, I want us to get out ahead of that to make sure that the service that people need, that students need, make sure that we're able to provide for that, and to the extent possible, elevate that so that the trustees of CCSD understand what that trauma looks like and what it might mean for future, and that there are some resources available to make sure that they don't reduce the people who we need the most right now.
Julia Peak for the record. Oh, sorry. Go ahead, Alex.
No, thank you, Chair, for that question. would be able to speak towards some of the things that we're operating under the Office of Minority Health and Equity, and then I'll turn it over to Julia and the rest of the team that is in Carson City who can also provide additional context. Under the CDC Health Disparity Grant, then now continuing under other grant funds as well, there was an initiative established with faith-based organizations and community health workers. The pilot was done in Southern Nevada and then for a year. And then after that, they worked to expand to Northern Nevada as well as primarily Christian faith-based organizations. But I do know that they were looking to expand outside of just Christian faith-based organizations. Those community health workers were trained in a multitude of different subjects. They had a specialized curriculum that went past the typical community health worker certification, and this was done, thankfully, with the assistance of the UNR School of Public Health. And I say all that to say that one of those things was with mental health first aid and their mental health first aid projects, and they, in addition to that training on mental health first aid, they completed a number of projects and commissioned a number of presentations to really help guide the congregants within their faith-based organizations on a variety of topics. And they started out their project by doing COVID-19 testing and distributing at-home tests and really tracking the impact within their faith-based organizations. And we have those reports that we can share following today's meeting for anyone who's interested. I'm now going to turn it over to Julia Peak and any other DPBH staff in Carson City.
Perfect. Thank you, Ms. Neal. Excellent resources that were provided. I will just add a couple. In addition to that, I just want to encourage folks to reach out to Nevada 211, as was mentioned prior, to find resources, as well as 988 if they are in crisis. Some of the things I did just want to highlight, as well as I noted it on one of the pages, but our resilience ambassadors, the good work done by them, also community health workers, and the opportunity to continue to utilize them in various settings, including schools, our nonprofit organizations. We're hoping to continue to do the good work with the community health workers that was started under the diversity grant. One of the projects that the legislature funded was to get more scholarships for community health workers to serve the communities in need. So encourage folks again to visit our website, nvhealthforce.org, if they're interested in becoming a community health worker, to be boots on the ground to help with whatever public and behavioral health resource navigation is needed. I also just wanted to mention that we are doing a lot of work in the interim. We're partnering with the Nevada Department of Education, all our DHHS agencies, the universities, to really look at providing holistic health services for our kids of childbearing, kids of school age, and their families as well. As we've gone through meetings and looked at needs, behavioral health continues to be at the top of our list. And so we're really thinking about a comprehensive way with all of these agency leads to figure out how to best address the needs of our youth, be it funding, policy, resource navigation within the schools, but also, as I mentioned, to have the family involved in that. So that good work is going on now, and hopefully initiatives will be highlighted in the future when we solidify much of our recommendations from that group.
Just want to do a follow-up. To the extent possible, Ms. Peak, and I don't know whether that's you or Ms. Neal, but can we find out whether or not CCSD has indeed decided to reduce the number of counselors / social workers? I think that would be a very grave mistake. And if that is indeed a reality, what is it that we can do to make sure that the services that the students need are still available to them, despite whatever the district has decided to do or not to do?
Julia Peak, for the record. Happy to follow up with CCSD. I do not know their stance on that and follow up. I will say that we are trying to do that that really holistic approach to addressing the needs of our youth, be it within the walls of the school or outside the walls of the school. So we will follow up with the Nevada Department of Education, who's working with us on that, and see if they know more on CCSD, but we're also happy to follow up directly with them. And then if they are reducing that staffing, we can look at how our efforts can complement that, again, either within the walls of the school or outside.
Okay, thank you. I think Senator Dondero.
Thank you very much. And tagging on to the chair's comments, I think that it's really great that we would compliment them if they are cutting back on that, but I don't want that to be the excuse to be able to cut back on that. As well as if you're going to follow up with CCSD, would you check with them regarding Hazel Health, their contract with Hazel Health? I understand that they may be canceling that district-wide and asking schools to take that on individually. That, to me, is a little bit of a problem because myself personally, I had 3 kids in 3 different schools. So if I have 3 kids in 3 different schools and one person has a problem, one child has a problem, and that school doesn't have services, or that school does have services, but my other child needs help because that child needs help. Now that school doesn't have services. Most families may have more than one child, and it may be at some point in their life they are in different schools. And so with that being said, all schools need to have access to that to service our families. That's the problem, to service families, which is why we're there. So that's another thing that I would certainly think is important for us to put on the sort of on the radar. Thank you very much, and thank you both for your presentation.
Thank you, Senator Dondero. Let me just follow up on that because I think what we're really looking at here, and Senate Bill, I think it was 402 or 204, I may have that, but it was in 2019, and it was the bill that required the Superintendent of Education, Nevada Superintendent of Education, to, along with each district, to develop a program, an instructional program, a curriculum, so that everyone who was anywhere in a school, that's the staff, that's the faculty, administration, that's custodial workers, food service workers, all of them, everyone was supposed to get some type of training in identifying depression and or suicide ideation. They weren't, it wasn't asking them to diagnose it, but there are certain things that happen that should raise a red flag. And that bill was brought to me by a student who was actually my youth legislator, who began his testimony by reading his suicide note that he had written exactly 1 year before that date. And so I want to make sure, in conjunction with what's going on with social workers and any other mental health professionals, that should be in every school, and it should be, I agree with you, Senator, that it should be district-wide and not school by school. So let's look and make sure that the statutes that are already in place that should be complied with, and to my knowledge, that has not been undone since we passed it in, I want to say it was 2019. And so any statute that was passed and implemented, unless it has been reversed, people are still required to comply with that. So I want to make sure that we're doing that well, because this is almost like when you drive down the highway and you see you're on an eighth of a tank, and you look at a sign that says next gas station 400 miles, and you keep going. So I want to make sure that we're, following up on this. On slide number 18. Chronic disease prevention, and this caught my attention because I've worked, I guess, about 4 or 5 years with Danette Bells and some others on kidney disease. So we were trying to get something done specifically in 2021 that would address that. So is there anything within this? The program also implements chronic disease prevention and health promotion. Is there anything embedded in here that would address chronic kidney disease?
Julia Peak, for the record, I'll call up one of our bureau chiefs as well, Vicki Ives, who oversees that section. I know that we had recent communication on the Kidney Disease Advisory Council as well. I believe that falls in her unit for her to highlight. So introducing Vicki Ives, our bureau chief.
Thank you, Chair. And for the record, Vicki Ives, Division of Public and Behavioral Health, Bureau Chief of Child, Family, and Community Wellness. Thank you for the question. The Chronic Disease Prevention and Health Promotion section, and specifically the PHHS, Preventative Health and Health Services Grant, does include components around kidney disease. The Kidney Disease Advisory Council is really in a building phase, and they work in concert with our the larger council on addressing chronic disease issues. So recruiting members for the Kidney Disease Advisory Council is a priority, as well as there are some goals within the PHH grant specific to supports in that arena. So thank you for the question, Chair.
Julia Peak, I will also just add for the record a thank you for Senate Bill 118, of which you all provided $15 million to public health. That starts July 1st. That is like PHHS. You all designed the legislation to help identify gaps in services. Chronic disease is probably one of the greatest underfunded public health services that we have, simply because we run on categorical grants often for that work. And so SB 118, in addition to what we can get through the PHHS block grant, will hopefully supplement our chronic disease efforts, because much of the work does not have categorical funding. And it's challenging for us at DPBH when we don't have a categorical grant, because we often don't have flexibility in funding. But through SB 118 and the PHHS block grant, those are the two that are kind of unique that give us some latitude.
Thank you. I want to follow up on slide number 31. And my specific question would be, how are we addressing women, veterans, and members of the LGBTQ plus community? Going to 31. Community mental health services. Because again, unless we put these things in here with some specificity, if we just look at an overall umbrella, we can be hitting, it's almost like just throwing something against the wall, but the target is missed, if that makes sense to you. So I'm looking really at veterans, specifically women veterans, because we don't do a lot that addresses their needs specifically. So how are we handling that? And then what does that look like for members of the LGBTQ community? And I'll go right back to what I said with respect to the bill that was passed in 2017, requiring the Nevada Department of Veteran Services to establish an outreach person. The only reason they exist, or one of the main reasons that they would exist, is to do outreach, to find those veterans who were discharged under Don't Ask, Don't Tell, and give them an opportunity to upgrade their DD-214. The more of those members that we find, and they now become eligible for VA benefits, then that reduces the amount of money that you have to spend on a category, and then those monies can be used for other people, if that makes sense to you. So that was part of the thinking behind that bill. So.
Julia Peak, for the record, and I did follow that part, and I will follow up. I do know our Office of Suicide Prevention lead, Misty Von Allen, does work closely on veterans issues. I would do an incomplete answer if I didn't reach out to her first and provide more information to the committee. But she has done work with them. I'll find out who, and I'll find out if it's specifically addressing the DD-214 issue that you identified, and then also the issues around women and veterans, suicide and mental health. I will follow up with the program and get back to you, because again, I'd give an inadequate answer just myself.
Thank you. And I'm going to ask Ms. Cooper, there are a couple of people that I really need to meet with after this to make sure that veterans outreach is actually being addressed, because as I look at the finiteness of agency budgets. This appears to be an area that, we could save money on that, but we could still accomplish the same thing in terms of serving veterans. Last but not least, I think that's it. Do the grants that you have, and I don't know, Ms. Neal, maybe that's in your purview, but maybe both. The grants that you have, one of the things that we heard in the 2021 session, I think when we were looking at SB 341, was the lack of diversity. And so do those grants offer any type of incentive to diversify in hiring? And, let me hasten to say before someone says we're doing EO hiring, no, we are not. We're talking about making sure we're casting a broad net so that people who would be eligible and qualified, who happen to be a member of a marginalized community or of a different ethnicity, make sure that they have an opportunity to be interviewed and to be hired. And so I'm looking at ways that we can diversify our staffing throughout DHHS, because as your slides clearly indicate here, there's a lot of grant money that's coming that addresses or is designed to address the disparities in many of these communities. And if we're going to have cultural competency as part of the training, then we probably need to have cultural competency with the hiring, because it matters who sits at the table. Does that make sense to you? It's just a question.
Julia Peak for the record, and I know Ms. Neal's done a lot in this area, so I didn't want to speak over her, but she, in addition to myself and many members of our community, have been working the last year and a half on a workforce pipeline specifically for health and behavioral health, to look at how we better prepare staff to work in the field and serve the community. So that includes both diversity related to race, ethnicity, sexual orientation, also geographic disparities across our state, looking at rural and underserved communities as well geographically. So we've prepared some reports outlining what we're going to do. I'll note that we, again, on that nvhealthforce.org, one of the reasons we developed that is because of challenges with pipeline and folks not understanding what they could qualify for. My specific interest is to get folks into state government, but that's a much broader tool. And so the ARPA workforce pipeline funds that we have calls out within it, looking at the geographic, the demographic need in the communities for community health workers, for clinical rotations, doulas, lactation consultants, all of the funds in which you all provided us through ARPA to have a diversity lens in looking at that. And they have to, within their applications, identify how who they're going to be serving, and then how they're looking at providing the funding for those applying, and how they're going to reflect the community in which they're going to be serving. So there's a lot in this area that we're working on. Again, the Nevada Office of Minority Health and Equity and the Minority Health and Equity Coalition are helping center us on a lot of this, and we go to them often for feedback. But Ms. Neal has been a great advocate in those meetings to give us ideas of how we can recruit within state government, recruit and retain, the combination of both of those things within state government to have a more diverse workforce. I don't know if she wants to add more on that, but I've appreciated her feedback and also Tina Dorch's in those meetings.
Thank you, Julia. What I would add to her remarks regarding the public health workforce plan, in addition to that, around the same exact time was the state health improvement plan was also being worked on. And so those same equity considerations are embedded in there. And also other examples of where there's an equity lens actually embedded within the infrastructure of some of these considerations and decisions includes from 2021 Senate Bill 390, which is what instituted the 988 crisis hotline in the state of Nevada, but also designated money towards opioid funds. And there was an opioid needs assessment and statewide plan that was done after that that really reflected who should be at the table and who should be involved in those conversations, and how should organizations that are in that space really engage communities that have been marginalized or communities that have disparate outcomes. And there was a choice point equity lens created by the Nevada Office of Minority Health and Equity, and is actually written into the report that can be found on the Division of Public and Behavioral Health's website. In addition to that, one of the sub-grantees through the Office of Minority Health and Equity to UNR, but specifically for the Larson Institute, and not the broader School of Public Health that was mentioned earlier before, facilitated a Nevada public health workforce gap analysis, including, and as a result of that, there was also a health equity in the workplace report and toolkit created that can be utilized and is promoted by our office to community organizations. It can be found through the Larson Institute Making Health Happens website. In addition to that, there is a concept called Health in All Policies. It's the same thing as the Nevada Wrong Door, and where at its core, the idea is no matter what area you're entering in your life, there's a health component, and that traces back to the Healthy People 2030 goals as mentioned earlier. There is an executive report that really reviews a lot of really interesting things, but one I would note is transportation equity across the state, and then how can the workforce around transportation equity really be mindful of the disparate outcomes that exist within the state of Nevada. So that's just a few examples of where equity lenses, we're really trying to embed them into the reports and the wordings and the toolkits. And then we're also, for, I know DPBH and for NOMI, we are also trying to take this to the community and to community partners, to state partners, to national partners and agencies, and let them know that this is a tool. We strongly advocate for those tools, and we really would like for them to implement them. And we could do a training and a workshop if they would like to do, organize that as well. And that's one of the ways that we try to change the system and not necessarily a moment.
Thank you. And I'm just going to take a leap here. And I know that there's been some consideration for what happens, especially in the rural areas with respect to transportation, because there's several inequities that exist there. So thank you all. Just for the record, a couple of things. The bill that I've been talking about that requires the Director of Veteran Services to do outreach is Senate Bill 148, the 2017 session, and it was codified in NRS 417.121. The bill that I talked about requiring training for some awareness to identify signs of depression and or suicide ideation, Senate Bill 204 in 2019, codified in NRS 388.256. And as I said before, I am not aware of any bills that have come forward since that time that have reversed those statutes, and so those are statutes that need to be there. And I'm going to really press hard about the collaboration and coordination with Department of Veteran Services, because that is, I believe, an avenue that we've not done a lot in. I'm not blaming anyone. I'm just saying that's an avenue that we've not done a lot in. And if we can get help from the VA, in addressing some of these issues, there's more money to go to people who do not qualify, civilians, those who have not served, if that makes sense to you. Okay? Any other questions? I think Assemblyman Gray had a question.
Yes, Madam Chair. It's actually for you and possibly a suggestion. With the bill that you've been referencing, you've mentioned don't ask, don't tell several times. So is that specific to the legislation from 1994 and beyond, or is it applicable to veterans prior to 94 that were put out for the same reason under other UCMJ actions?
I'm glad you asked that, because in the bill we do address don't ask, don't tell specifically. And prior to that time, there were other areas that people were, quote, witch hunted into being discharged. The whole purpose for the outreach and the Department of Veteran Services is to help find those individuals, and if that is a reason that they were discharged, to make sure that we upgrade that. Because depending upon the homophobic nature of the command, the person might have received a dishonorable discharge, which is just like getting a felony. Other
Well,
than
yeah, they would have had to have
honorable
been,
or,
they would have had to have been convicted by a
well,
court-martial.
not necessarily. Well, they may have been convicted, but the only conviction had to do with their sexual orientation. And
Right.
we've become a more enlightened society now. Okay, so that's it. It's Senate Bill 148, and the codification is in NRS 417.121. And we were specific about what that would look like because there was an executive order that was issued to make sure that that happened. And I know that because I happen to chair the NCSL subcommittee on veterans, military veterans, and families. So we can go through that offline, and I can satisfy whatever the real question is on that. But it was not designed to give everyone blanket, but it was designed to make sure that those persons who were kicked out of the service based solely upon their sexual orientation.
Agreed.
And by the way, I've seen about 3 or 4 of them already. So that's the purpose of the bill. And as I said before, unless it has been reversed, and to my knowledge, it has not in succeeding sessions. And so that is the law.
Yeah, no,
Okay.
that's great. And my
Thank you.
concern was that we've got veterans out there that are being missed. I've got specifically thinking of a friend in '91 who was discharged prior to Don't Ask, Don't Tell for the same reasons. And I think some work this committee may consider, I'd like to bring up later on, is maybe looking at some of the veterans that were discharged for TBI-related actions. TBIs affect behavior, and when I worked in a congressional office, there were a lot of veterans that were denied veterans benefits because of TBI-related issues. So, just a thought.
Yeah, and I think that's valid, and we can certainly look at doing that. Because I think some of that may fall under some of the statutes we do with Veterans Court. But a good idea. We'll take a look at that. But even if they were discharged prior to Don't Ask, Don't Tell, we all know the witch hunt that took place in the military, and people who were willing to serve and had to serve in the closet. Raise your hand, Senator Spearman. Had to serve in the closet, but all we wanted to do was to serve our country. And because of who we loved, were denied an opportunity to serve openly. And those who were discharged, whether they were or were not, sometimes there were people who were discharged because there were charges that were trumped up charges. Just cussed. Anyway, there were charges that were not valid, but they were discharged. So the whole idea of 148 is to make sure that those veterans had an opportunity to get their discharges upgraded. And it was a shame because there are people who are in Arlington National Cemetery who served, and they happen to be members of the LGBTQ plus community. Anyway, so are there additional questions? Okay, all right. So thank you so much. Are additional comments? DPPH? Nomi? No?
I would just say thank you for, Alexandra Neal for the record. Thank you for allowing us to present today. We will follow up on those actions that were noted.
Julia Peak as well. I will follow up on the bills you noted, and I'll also follow up with CCSD on the various items noted. I wasn't aware of those. And Valentine's Day shout out to my husband, a native Nevadan from Eureka, and I'm a native Nevadan from Douglas, so, and our 3 kids. So thank you for the opportunity to present.
Thank you. Okay. Just getting ready to go to lunch, but it's not here yet, so can we drive on? And anyone that needs to take a bathroom break, just do it as you need to. And as soon as lunch gets here, we will break for that. And so, item number 7. Presentation on federal and state initiatives pertaining to senior citizens. And representative from AARP, I think it's Jessica Padron, and you have a new name that I have not committed to memory. Congratulations on your recent nuptials. Yeah, and Jessica happened to be my legislative assistant in 2017 when I had an opportunity to work on a lot of these things. So thank you for your work then, and thank you for your work now. Okay?
Well, thank you so much for for welcoming me. Good morning and almost afternoon. My name is Jessica Padron. For the record, it's my pleasure to be here today and to present to a legislative committee on senior citizens, veterans, and adults with special needs. Really quick, Valentine's Day shout out to my husband, Gregory Alciquiez, and to my family, Jose and Maria Padron. So thank you for the opportunity to speak today. I'll try to make it brief so we can all get lunch. But honestly, today is just a friendly presentation overview, and I'll be covering an overview of my organization's mission, our policy priorities based on advocacy being done at the national level and what's going to guide our work in the coming year. A recap of our 2023 legislative priorities that were done prior to me joining the organization. So to the best of my ability, I'll be covering that. And some of our local resources and programs that we offer here at the state level through AARP. And then, of course, I provided some exhibits to the committee, both our state level overview of caregiving laws and policies supported by AARP. This was provided to me by my colleague Deonza, who at our national policy level handles caregiving and was so kind enough to support with that material for today's presentation, as well as my other exhibit, which is the AARP state fact sheet. And this is a very helpful overview of some information of our members and their concerns here at the state level in Nevada. So very quickly, our mission at AARP, of course, for those of you who haven't worked with us previously, is dedicated to enhancing the quality of life for all as we age. We lead positive social change and deliver value to members through advocacy, which at the state level is under my bailiwick. Service and information to make things better for society and play a positive role in communities of all kinds. So while many associate AARP specifically with the 50 plus demographic, our work and our organization is open to all who fall under and can benefit a lot of our policies. One example, of course, in specific is caregiving, which is something that this committee has worked extensively on. On the advocacy perspective, AARP is the nation's largest nonprofit nonpartisan organization dedicated to empowering Americans 50 and older to choose how they live as they age. Our advocacy efforts have been nonpartisan since our founding in 1958, and of course, as a result of that, we don't contribute to political candidates, parties, or campaigns, and never have, which I thoroughly enjoy and makes keeps me out of drama. So here at the state level, we have 352,000 Nevadans that are members of our organization. And now I'm going to be covering some of the things that we are focused on for this year and moving forward. As of right now, nationally, our organization is focused on two primary priorities, which is protecting Social Security and supporting family caregivers. We currently are pushing for legislation at the national level through my colleagues in DC for things such as a tax credit for caregivers. And that is something that I am looking more forward into here at the state level. Since we don't have a state income tax, there may be other creative ways that we can look forward to supporting family caregivers. Other priorities, things that we've worked on, such as lowering drug prices, and thank God after nearly a decade of advocacy, now Medicare drugs are being negotiated, which really takes and alleviates the burden for seniors. Financial security issues, food security, telehealth, and of course something that is very privy here to Nevadans, fraud, financial exploitation, and consumer protection issues. So that is going to be guiding the work that I will be doing moving forward now that I've joined the organization. And I'd like to cover some more detailed information on that, guided by what we've seen in other states and through our work at a national level. So fraud and elder financial exploitation are often confused. So a really great tip that was shared with me at differentiating the two is elder financial exploitation is usually the person you know who's most likely a caregiver or someone in a position to oversee that power over this vulnerable adult or individual and exploiting them and taking access to their funds. And then, of course, fraud is stranger danger. So that's an easy way to differentiate the two. And that would include things such as imposter scams, romance scams. This time of year, we actually are doing Cupid Crew right now at the Martin Luther King Senior Center, giving roses to seniors and discussing issues such as that, which many folks unfortunately fall victim to, where, someone romances them and then empties out as much funds as they can from their assets. Lottery scams and identity fraud are also considered forms of fraud. And then just to review elder financial exploitation, and that is the known danger. That includes embezzlement, falsifying records, coerced property transfers, and denial of access to assets. A little bit more on fraud. And some really important facts to consider. Younger people reported losing money to fraud more often than older people. They do at a larger percentage. However, even though they lose money to fraud more often, it's typically smaller amounts. And this is why it's so devastating to the 50-plus community, because older people lose so much more of a percentage of their total funds. When they fall for a scam, unfortunately, usually it can be driven by fear, urgency, some of those common tactics used by scammers, and they pull much larger amounts. And specifically here to Nevada, one of the statistics I was able to pull is the state of Nevada ranks fifth in the number of identity theft reports, which also constitutes 22% of all reported fraud in the state of Nevada. And in the year 2022, the loss for fraud and scam victims over the age of 60 as a total was $38,563,008. So these are very large numbers, and as I said, devastating to those who get affected. One thing I do want to mention before I move forward into caregiving is when it comes to fraud, one of the reasons why it's such a large issue is it is vastly unreported. Many people feel embarrassment that they fell for the fraud and maybe see little recourse in reporting it. So therefore, these scams are able to continue to proliferate. So what we really push for at AARP through our Fraud Watch Network and our many other services when it comes to fraud is the importance of reporting, because that allows us to identify trends, to report them, to work with other agencies, or in the case here at the state level, we have done a number of teletown halls to our members across the state, working with the Attorney General's office to talk about trends, what to look out for, and really prepare and warn folks so that they don't fall victim to scams and frauds. So when it comes to caregiving, AARP has an over 60-year history of advocating for older adults, empowering them to choose how they live and age, and fighting for policies that allow them to age in their own homes and communities where we know through our research that they would like to be. Recognizing that family caregivers are critical to aging in place, AARP accelerated our advocacy work on behalf of family caregivers since 2014 with things like the CARE Act, which is now in law across the country in many states, and we're continuing to do that work. So I was able to pull some information specific here to Nevada. We have 340,000 caregivers currently here in the state of Nevada that we were able to identify. And when I say a family caregiver, I mean an unpaid family caregiver, someone such as myself caring for my parents, someone caring for their spouse, or maybe for a child or someone who is of limited mobility capability. A lot of people, when they think of caregiving, they may think of parents caring for their children, which of course is an important part. But in AARP's terms, we're talking about this major labor force that really is holding together a broken care system. So in Nevada specifically, just here in the state of Nevada, we have over 320 million hours of unpaid family care. And that equates to 5.1 billion in unpaid labor per year. I also provided some of the statistics for nationwide. I do want to highlight 42% of caregivers quit their jobs or cut back on hours to meet their caregiving responsibility. It truly is a labor of love. Many families are very concerned about the cost, right, to the state and to their own families of putting their loved one in a long-term care facility or other facility pertaining to their needs. And not just that, the quality of life and the change. Through our research, as I stated earlier, AARP has identified that for many, those facilities are last resort. They want to do everything they can to be where they're comfortable, where they're familiar. My dad, for example, is very limited vision and really only knows how to get to our old house, to our new house, and to the grocery stores that he goes to every Wednesday. So when I moved, he was very disappointed. And, small changes like that can make a huge effect for people who may have vision issues, mobility issues, things like that. And what we see in our membership across the country through our research is we want to do everything we can to allow them that comfort of being able to live in an age-friendly city, county, state that allows a lot of these policies that would make it more comfortable and easier for them to age in place, including things like supporting caregivers. Moving forward, our 3 guiding advocacy principles when it comes to our major objectives on caregiving is it really makes it easier to guide all of our legislative work, which is make providing care easier. So we, through our organization individually, have an expansion of navigation resource tools and navigator training, as well as through increased access to care at home and other support. So through AARP, we have a number of partnerships with organizations across the country, such as CareLinks that offers respite to caregivers, which is a very important side of caregiving that isn't often looked into. Caregivers, in addition to the financial burden, and I wouldn't say is the proper word, but the financial cost to caregiving, they also have a huge mental health toll in many cases, and their own health declines with care if they aren't offered the proper support. Time and time again, polls have showed that caregivers really feel like stressed out and they don't have as much support as they need. The second guiding advocacy principle is alleviate the financial challenges faced by many family caregivers, challenges that can undermine their own well-being, including better access to respite care, paid leave, family caregiver tax credit, and reimbursement programs. And then finally, improve health and well-being of caregivers themselves. So as I mentioned, many of them have seen their own personal situations worsen, including through needs assessments and other tools. We are trying to address that at our own level, but of course through advocacy, working with state legislators, working with other organizations, working and doing what we can outside of our network, using our resources to help spread the message and increase those resources available. So now I'm going to provide a quick recap of the 2023 legislative session and some of the bills that my colleague, our state director, Maria Moore, helped work with many of you on and with great support from our national policy team. I joined shortly after the session ended, so I was able to write up a recap on some of these things, and I'm happy to follow up afterwards offline. Any questions, I'll be providing my contact information at the end. So in 2023, two highlights that were very important to the organization that we were very grateful passed was SB 305, which created what we call our Auto IRA bill, or the Nevada Employee Savings Trust, which created a public-private retirement savings program for about 300,000 workers. And basically, for folks who don't already have an employer retirement program, pension program, IRA, this really helps them out so that they have the ability to take in their own hands and financial responsibility to plan for their retirement. What we are seeing as we get into, as Senator Spearman said, a graying Nevada, many people don't have as much funds as they need, and some of them are realizing it the hard way. Through very limited income. I'll give a very specific example. When it comes to Social Security, 47.9% of Nevada recipients have a reliance of 50% or more of their monthly income on Social Security. And when we look at 90% or more, basically their entire income that they rely to survive on, that's 26.8 Social Security recipients. So that's a very hefty portion of people that are relying on that program. And, it doesn't stretch far enough for many of them. So what we want to do for the coming generations, and this is an example of a bill that's for all, really, through our work and our mission, is making sure that people have the ability to take their retirement in their own hands if they don't already have that option provided to them. SB 355 is a bill that really, for us, was very, very important when it comes to what are known as NTRAPs, an unfair real estate filing fee, and kind of a secret thing that gets added to your contract for many vulnerable citizens, not just seniors. We saw BIPOC individuals and other vulnerable folks that maybe are not in the best financial situation, or maybe they are, but they're just being constantly harassed by those sell your home now groups. And what happens, what was happening in many cases, and AARP caught wind of it, it started working at the state level in several states, was working on addressing that NTRAPs so that when it could be removed from the deed, from those documents, because what was happening is it was staying there as a lifetime addition. So no changes could be made without permission. Sometimes you were forced to use the vendors that they use, a very limiting and very predatory practice. Some of our other bills, I'm going to go over Assembly and then Senate. AB 100, which was briefly mentioned earlier, authorizes a study of family caregivers to assess the capabilities, needs, qualities of life of family caregivers. And AB 119 is the Vulnerable Adult Fatality Review Committee to review deaths resulting from adult maltreatment. AB 130 requires assisted living facilities to include operations costs when applying for grants through the state's tobacco product settlement. Facilities that meet the criteria will be prioritized for future grants. And then AB 208, this bill established a program for a structure for family caregiving recipients of Medicaid suffering from dementia in Nevada. And this will allow any person to serve as a family caregiver and permit care to be provided in the home or by an intermediary service organization with Medicaid, picking up at least 65% of the daily rate paid. So this expanded access. At the Senate level, we have three bills to highlight, and that would be SB 45, which provides for at least $30 a month Medicaid allowance for personal needs for a resident of a skilled nursing facility. AARP, as I mentioned, is very much about choice, options, and allowing people to have, for lack of other words, dignity. So I feel like this is a great bill that allowed them to get some of those other things that they need. SB 61 cleans up existing laws related to the ownership of joint accounts and the exploitation of older vulnerable persons. This is something we want to look more into in the future as well, just making sure that when it comes to scams and financial exploitation of older individuals, that we're looking at every avenue possible to limit that and work to provide a safer Nevada for older Nevadans. SB 298 ensures that providers of home and community-based services in a provider-owned or controlled residential setting receive comparable protections from evictions under the state landlord-tenant law. And that would just allow a little bit more of a period so people aren't suddenly day of or with a very limited window forced to make other plans, especially as mentioned earlier, some of those folks that are of older age here that move here for the weather, their family's far away. They can't just make an arrangement day to night. And now I'm going to move into our local work. So here at AARP Nevada, some of the programs I wanted to highlight that can be of benefit to Nevadans would be our caregiving resources at our Nevada State Office located here in Southern Nevada. But we also do have a lot of ability to send that throughout the state. Would be our Prepare to Care guide. We have a number of these materials in both English, Spanish, and I believe a couple other languages. Our AARP Fraud Watch Network scam tracking map is a very useful tool. It shows, as I mentioned earlier, trends, what kind of scams are prevalent, where they're taking place, and that's just one of our tools. It came to my attention early on when I joined the organization. AARP is one of the main organizations nationally that has a number of tools and resources at its disposal to help people who are victims of fraud and scams and help implement measures in place to prevent that or limit it. Our AARP Livability Index is just one of the tools through our age-friendly advocacy. So I did a brief mention of this earlier, but AARP has a program known as Age-Friendly or Livable Work, and that is where certain communities can apply and offer a proclamation, say that they want to be an age-friendly community, and with their investment, either through resources, citizen task force, volunteers, AARP then provides a number of resources to help them develop these plans. I believe the Office of one of the presentations earlier mentioned a multi-sector plan on aging. Age-friendly really goes hand in hand with that. It's something that brings in elements of public health, planning, transportation, all of that into making a place, quote unquote, age-friendly, so that, for example, if it takes widening a sidewalk just slightly more, or looking at the walkability in a region where there's a huge population of seniors. I want to highlight some of our current age-friendly communities, and starting off with Henderson. Henderson has received national attention and has been recognized for their work as an age-friendly community, sizable investments from the city. Most recently, I just testified in support of one of their new ordinances, which allows ADUs and tiny homes on a larger scale, so that will help address home affordability for folks who maybe want to size down or age in place, have that ADU to live with family members as they age. So age-friendly includes currently Henderson. We have age and dementia-friendly Winnemucca. And we are working right now with age-friendly Sparks, Reno, and Washoe wants to, hopefully we can bring them all in coordination. So I'm hoping to continue expanding that to other cities such as hopefully North Las Vegas, which I see huge potential as a very large, growing, and diverse community. Other things to highlight is our AARP Smart Driver course. This is part of our driver safety and driver's aids programs available. And then we have our tax aid locator. Just want to give a quick shout out. It's almost tax season. And on a wide scale, we have an army of tax volunteers to do taxes for free for the community. If they sign up in a timely fashion, it does fill up very quickly. So AARP has that service in mind, particularly for seniors who are on a fixed income. Or anyone on a fixed income. This includes veterans, anyone on an underserved community. Check it out. And then, of course, our volunteer network and statewide opportunities include things like Walk with a Doc and some of our other regular programs. And we do have a number of events coming up soon. So I hope that folks can reach out For that, I am providing our information. Our state office is located on Eastern and Russell. So we don't typically work with the membership side, which signing up, all that can be done online, but the state office does offer local resources and information. And then, of course, my contact information for any follow-up questions. With that, I yield my time, and if there's any questions, comments, or anything I can support with, or I can follow up at another time if everybody is super hungry or something. So I tried my best to be brief, concise, and I appreciate your time.
Committee questions? Yeah, Vice Chair?
Thank you, Chair. Thank you for the presentation. I love the data, right? The numbers of caregivers. I'm curious to know if you have any additional delineated data that would help us better understand who are caring for seniors, who are caring for their parents, who are caring for children, perhaps with disabilities. I just would like to know if we can drill down a little bit more on the slide that you presented, Nevada Unpaid Family Caregiving Labor Force.
Yeah, Jessica Padron for the record. So I really appreciate the question. Thank you, Vice Chair. As I mentioned earlier, we do have a very robust research team, so I can definitely send the question to them and see if we are able to delve more down into that information, and happy to follow up and provide that at a later date. Absolutely.
Additional questions? Okay. Assemblyman DeSilva?
Thank you, Chair. Thank you, Ms. Padron, for your excellent presentation. I had a very quick question here. So you mentioned that identity-related fraud constituted about 22% of all fraud that was faced by seniors. My question is this: where is it happening? Is this primarily through data breaches, I'm assuming? And has there been any sort of a way of maybe looking at how to protect those certain forms of data breaches? Is this happening through, I don't know, healthcare agencies? Is this happening through other entities like that? Is any sort of delineated understanding as to where those, their identities are being compromised?
Yes, Jessica Padron for the record. Thank you for that question, Assemblyman DeSilva. I actually would love to loop in my colleague Riley Franco on this. She is our state expert when it comes to fraud work, and leads that work. And she could provide more detailed information on fraud. But per my knowledge, I've learned quite a bit in my time with the organization, and a lot of times you'd be surprised. Even some of the old school scams prior to Thanksgiving time, the AGs, we had a contact in the AG's office who reached out to us to make sure that we sound the alarm on gift card scams that were on the huge uptick once more. And they had updated some of their techniques on how they do it. And a lot of folks were losing money from the trends that they were seeing. So I'll be happy to follow up on that information. But from what I've seen, we look at all types of scams from fraud breaches. But I really think a lot of the time it comes to that one-on-one contact and misrepresentation of either, a romance scam or some sort of urgency or fear-driven scam to where do this now or something negative will happen to you, a loved one, you'll lose your home, things like that. They're kind of basically just driving on our emotions and our fears to get someone to act quickly without consulting or thinking with their family first prior to depositing those funds. But I will be happy to follow up.
Anyone up north? Questions, comments? I just have a couple, because the food's here. Last summer, we spoke about they had a seminar in California for senior members of the LGBTQ plus. Are there any plans to maybe do something like that here in Nevada? We've gotten a lot of information from DHHS about some of the programs that are going on, and given the disconnectedness, the dual disconnectedness of that particular community, are there any plans to maybe do something like that, or, partner with somebody to do something like that?
Jessica Padron for the record. Thank you, Chair, for that question. So in a lot of our work, we try to be especially now that I've taken on our multicultural work, I try to bring intersectionality into all of our programming, all of our events, everything we do. Last year, one of the things we did was participate in Pride, and that was our main LGBTQ focused program, including our LGBTQIA plus Prepare to Care guide specifically for that community. Along with some other materials and swag that we had specifically for that community. But that is something that I would like to see us expand and do more on. So my colleague Erin in the past has led on some of that work. She also leads our communications here at the state level. So I'd be happy to follow up with her and see if there is time in our tactical timeline that we can fit it in and make sure we work with partners such as the center, other groups that are doing year-round advocacy on this and that are for like the forthright experts on working with that community so that we can make sure that we are doing culturally sensitive, appropriate engagement and maybe offering education and opportunity for some of those members that maybe haven't felt previously open to discussing some of those issues.
Thank you. What about any programs, especially during election cycles? Sometimes seniors are targeted for misinformation. So are you all doing anything relative to that? I'm thinking specifically about with the Secretary of State's office.
Yeah, thank you, Chair Spearman, for that question. Jessica Padron for the record. I actually am really glad you asked that question. So misinformation has been a huge issue for everybody, really. Communities of color, any demographic has been targeted in a number of ways. When it comes to seniors, AARP is doing our part at the very beginning of the year on the 18th of January, and then we followed up on February 1st. We hosted 2 teletown halls, the first of which was specifically about the upcoming election. And on that call, we worked with the Deputy Secretary of State and with someone from Clark County Elections Department to discuss all the very confusing details of our presidential preference primary versus caucus and addressing and inoculating a lot of that misinformation so that folks knew when, where, how to vote and how to contact those 2 elections experts, as well as resources such as our AARP voter guide. And on those, as I said, we are a nonpartisan organization, so we offer all the material required for people across the spectrum and all the details of when, where, how, and thank goodness we have a lot of those options available here in our state.
Thank you. Last 2 questions. So I heard from a couple of seniors last session about HOA exploitation, charges being charged for something that they had no control over, and then the fines or the fees or whatever it is just kind of escalated it, and they were just about to lose their home. Are you all doing anything with those sorts of activities?
Jessica Padron for the record, thank you for the question. Per my knowledge, I'm not aware that we've done HOA advocacy work in the past either at the local or legislative level, but that's definitely something I can look into and get back to you on to see if we've taken previous action and where our policy stands on that currently.
I should have said this earlier, but one of the things that I'd recommend if you don't already do it, there's a question you can put on any survey or whatever, says, have you ever served? And that would help us identify veterans and where they are. And so if you haven't done that, that might be something to consider. And with respect to the voting piece, there is in Nevada Constitution, as of 2020, Help America Vote Act, all of those tenets, I think it's like 13. And so you might want to employ that as part of your discussion with seniors with respect to voting, the things that they have a right to do, receive another ballot, get questions answered and those sorts of things, as well as the constitutional amendment, the Equal Rights Amendment to our Nevada State Constitution, because age is specifically identified there. And any one of those areas now elevate to a higher level of scrutiny if anyone is ever discriminated against. They have a constitutional right to do X, Y, Z. Okay. Questions, comments? Anyone else? Okay. Thank you, Ms. Padron.
Thank you, committee, once again for allowing me to present, and I'm at your disposal for any questions or follow-up. Thank you.
Thank you. And with that, we have the food has arrived, and it's 12:25. Let's take about 25 minutes, which would get us to 10 minutes to 1. Is that right? 10 minutes to 1? 10 minutes to 1? Huh? Mathematician. Oh, no, I'm just looking at the clock. The little hand is on, the big hand. Okay. You know, Mickey's hands. Anyway, so let's try to be back here real time at 10 minutes till, not legislative time, 10 minutes till, and we will get started. And we are on agenda item number 8. Agenda item number 8. Okay? And so with that, we will stand in recess. Thank you. Okay, good afternoon. We are back, and we will proceed. I hope everyone had a good lunch, and I hope you didn't eat too much or too fast, so there's indigestion. But if there is, we may have somebody here that can help. Anyway, we're going to go to agenda item number 8, presentation on quality of life issues and healthcare concerns related to senior citizens in Nevada. We're going to be going to a representative from Sanford Center for Aging, University of Nevada, Reno School of Medicine. Is it Tabor Griswold?
Yes, it is. Thank you,
Up north?
Senator Spearman.
Okay. Okay. All right. Okay. There you go. There you go. Okay. Yes, ma'am. Please proceed.
Dr. Peter Reed had sent me an email and said he was not able to present, and he is obviously the director of the Sanford Center, which does many different programs helping the seniors. So he told me, he goes, "You're good with data. I think that you should talk." And I chose not to do a PowerPoint because I know a lot of data, and once I get going, you thought the other presentations were going to be long. I'll put you to sleep however long I can do it. So I've revisited this, and thank you for this opportunity to discuss the quality of life and what I can add to this discussion about our seniors in Nevada. It's my understanding that few people have seen this document, which is the elders count in Nevada. It was originally done by the Sanford Center and then the Center for Healthy Aging, and then Dina Schmidt decided that this would be a good publication for the Aging Division, and then they also updated it 2 years later. So since 2005, there have been 4 editions, 2 of which have been in the last 2 years. This is a high-level look at data. There's very few tables that go down to the county level, which is what my specialty is. I work for the School of Medicine and the Office of Statewide Initiatives, and our primary publication is the Nevada Rural and Frontier Health Data Book, which many grant writers use, a lot of health policymakers, but it does not have a lot about the aging population in it. I updated some strategic factors at the county level about the aging and demographics, and then I discovered a website, which I will discuss in a moment. What I wanted to discuss first was that at the beginning of the Elders Count book, they actually have put together their policy recommendations. Now, our seniors as a whole are living well whenever you look at the data. It's when they haven't built their retirement well, or they have an unexpected injury, or a chronic disease, or an economic factor negating what they thought they were going to have as a retirement. And that is why all day long I've been listening to all of these interventions that are happening, because they are helping the minority of our seniors to be able to function and have a good life. And so the policy recommendations in the Elders Count is improving access to evidence-based chronic care interventions, increasing family caregiver support, creating innovative mental health support, strengthening protections against elder abuse, housing, employment, transportation, empower individuals to develop an action plan for successful aging, and then the development of a statewide healthy aging campaign. These are what everybody has been talking about today. And if you go out to the DHHS website on their data dashboards, they have a lot of information about the health condition in Nevada, but not a lot on seniors. So that's why this is a very important publication for what we have been discussing today. And I'm flipping through this because there was actually a suicide chart in here. And it shows the bottom line for the 55 in the US, and every age break in Nevada is above it. That's why this is something that you can have in the back of your pocket. Now, within this, they actually have links to 3 additional studies, as well as the list of the local Nevada sources they use, the US Census. And the first one that I want to talk about is a study that I was brought in on in 2020. And it's a feasibility study of a combined license for assisted living facilities, adult day, and respite care services in non-urban Nevada. This is 350 pages of, and includes an economic impact. The piece I was asked to write on it was on the workforce in Nevada, and it was requested by Peter Goycochea, and because he said, I can have the mines build an adult daycare in Eureka. Can we run it? And the answer is not just no, but an emphatic no, because there's no staffing. You cannot bring the staffing to Eureka to run an adult daycare center. So I sent this link on to the group, and because it's such a big study, I'm leaving a copy. And if you want to look at it, they have the link at the group. The major part that I wanted to discuss on this has to do with the housing piece in here, and it has to do with the support staff needed for the healthcare industry. Let's just put it that way, for seniors, home healthcare industry. We have an evaluation here at the US level so that you can see that this is not a problem that is unique to Nevada. It is just worse in Nevada because and this was in 2020, we were 48th then. And now we have more people have moved in, and we have all these other issues. Hence, I'm not so sure we treaded water. Supporting this large study was a study from the Gwynn Center, which is Helping Hands, an assessment of the personal care aid workforce in Nevada. So I had to pull this down and read it because I wanted to make sure that it supported what we had discovered in AB 122, and it does. This particular part of the long-term services and support workforce sits at 60% of what we need. What's nice on the AB 122 study is it actually went into the why of the shortage in the personal and home health aid workforce. It had to do with their payment structure. It had to do with their work structure. It had to do with their travel reimbursement, all of that. And it's well documented in this study, and I highly recommend that someone take a look at it to figure out why, some possible ways of fixing that why of the shortage. Then, from the Gwynn report, it says there is a need to increase this workforce by 81% to keep an adequate number of home health care staffing for services for older adults and disabled in their homes. That's just a piece. When you looked at the chart that was displayed earlier, you saw it was a 50% number on that chart for the personal care and home health aid services. So ignore my 81%. We'll go with theirs because theirs is more recent. But still, 50%. I say that we have, and that was on their staffing of 1,335 people. I looked at the entire workforce, which was like that we should have compared to the national average, which is 15,000, and we have 8 that are working in this category. Now, who are all the other people who are helping on this? They are the therapists, the nurses, nursing assistants, LPNs, but they're not the primary support system. Now, another report that was mentioned in the elders count is by the Nevada Office of Food Security about the nutrition programs for older Nevadans and their primary recommendations. And that one I found very interesting because we think everybody has food. And when you look in here about the distribution of the food bank, and there was something in the news recently where it was like a huge number of meals that had been served, that makes you wonder just how well people are able to deal with their housing issues, their food issues, which are primary concerns for this for this group of population. And there's my professional research into the healthcare workforce. I finally pulled out the geriatricians that we have in Nevada and compared it to the national ratio, and we're comparable. So that doesn't mean that we have a shortage. What that means is that most of our people have a primary care provider, if they have insurance, there's a lot of ifs in there. Once you have one, you don't leave that person unless you have a situation where you need to have specialized care. So when we talk about how well people are doing, that's because they are healthy, they have money, they have ways of dealing with being retired, or they are continuing to work. So all this discussion, everything that I've been keep looking for is, well, where's the race, ethnicity, the diversity, the thing that I've been able to identify is a difference between the rural and the urban. And in discussing the feasibility study, when you look at the Bureau of Labor Statistics, they have 100 people working as caregivers in rural Nevada. What that actually means is that everybody is dependent on their neighbor. If not their family, their neighbor. They're dependent on their community resources. And as people had said earlier, these are unpaid. These are people who are willing to help out. There is a little anomaly where it says that Carson City has way too many of these people for the population because that's where the people are from and they're going out to the rural communities. It's the way the healthcare distribution works in Nevada. So I wanted to close with the online website that we support in the Office of Statewide Initiatives, and it's called Nevada Instant Atlas. And it's a compendium of county-level data that is accessible from established sources. We don't put, I put data out there if I find a project or a program that has been vetted and established by someone else with good data, and I will put those special items of data out in the Nevada Instant Atlas. And one of them was a discovery that's called Mapping Medicare Disparities by Population. And it's been out there for 10 years, and it actually was to track those hospital readmission rates when the hospitals were going to be fined if they had let somebody out within 30 days. And it has turned into a very robust website. It tracks prevalence rates, strategic mortality rates, and a very large section of 30 indicators on behavioral, screening, activities, and as well as the chronic diseases and conditions leading to chronic diseases. And I've not had the staff to be able to do this data. CMS has put it out there for the whole country, and there is one caveat. It is the Medicare fee-for-service data. So these meant that when you do the drop-down button on Medicare Advantage, the last thing they put out there was 2018. The current data is from 2012 to 2022, plus they do rounding, and it is at the county level for the whole country. So all 17, maybe not all 17 of our counties are representative because we have some counties with very small populations. The data is by the residency of the Medicare enrollee, and it is all phrased in terms of a percentage of the Medicare enrollees. But if you know what the Medicare enrollees are for a county, then you can interpret the actual number that is in there. I did a presentation years ago with Dr. Hunt from UNLV, and we explored the depression factor with obesity and Alzheimer's. And it has you can do a little ANOVA on it. And the takeaway from it was, if it is a condition that you can control and that you can have health care for it, your depression factor becomes negligible. If it is something that you have no control over it, then the depression is a full correlation up to like 80%. So it was very, very informative, and that's why the idea that I've always had, and I would love to have somebody tell me that they could do this, is a county profile using the CMS data showing what the status really is of the care, the preventive care, and obviously the prevalence and the serious hospitalization, plus it also has costs out there, of the impact on these counties of their senior population. So I will now open it up for questions. I didn't want to talk about data. I wanted to talk about how to find it, because we really have some amazing ways of doing that. And thank you for this opportunity. There are
Committee members' questions? Yeah. Vice Chair?
Thank you, Chair. Thank you for the presentation. I just have one. I opened up the Nevada Rural and Frontier Health Data Book, 10th edition. It says that it was printed on 2021. I'm just curious to know is there a new version available that I'm not seeing?
Thank you for that question. Courtesy of ADA requirements, we can no longer post the digital version of our data book on the UNR website. So I have sent the link. I have actually sent the digital copy of it, and I brought in 11 copies of this and the elders count and gave it to Jennifer, and she will be sending it down there to you. This one is the 11th edition, and the Nevada Instant Atlas currently, when we find the county level, for the 12th edition, it is in the Nevada Instant Atlas, as we put it, because that's where my database resides. So I am so sorry to hear that you have the 10th edition, but we are dealing with the fact that we cannot put it out there. And so I keep trying to find bureaus who will be willing to post my digital copy of it on their website so that people know how to find it. And it's just, it's like 150 tables in here, and to do ADA compliance on it is just impossible. But
Thank you. I appreciate the information.
Yeah, very important question. And the article and what I have here is coming your way.
Thank you. I appreciate that. As a disability rights advocate, I would encourage you to work with your accessibility folks over at UNR. There is a way to put the book online to make it accessible and in compliance with the Americans with Disabilities Act, which is really more than 30 years old. And so it would be awesome to have that book available to the population of people who are also interested in reading that may have low vision or be unable to access it in other ways. So there are mechanisms, and I do appreciate the complexity in that, but having public information available to all of our residents is really important. I thank you. Thank you very much.
Well, I do my own ADA compliance. That's why I know what I can do. And there was a new program that they put in at UNR. And they won't share it with me, so I can't do it. And so it's not that I can't do it. I don't have the time to do it. So that's just, I appreciate your comments that it could be done, but it's not going to happen in a time frame conducive to getting the distribution out. So thank you.
Thank you for your comments. I do sincerely appreciate the complexity of that. I'd be happy to reach out to the President's office to assist you in any way possible to ensure that the data that you are circulating publicly is also available to the population of Nevadans that are not able to access it in this format.
Yeah, I don't. Thank you.
And I would concur with that.
Tabor girls will say, I don't want to cause waves, okay?
So this Chair Spearman, I don't mind waves. We'll get a bigger boat if they get too big. But I believe our Vice Chair is correct, because as we've heard in previous testimony, Nevada is graying, and I think there are layers, multiplicity of layers that need this information to make sure that we are ready. And so, Vice Chair, I'm going to encourage you to use that, contact the President, you and our President. We might still know him. Some of us had a relationship with him when he was in another less prestigious job. Pun intended. Okay. But I concur with that. The one thing that I'm going to ask you to do, because you presented a lot of information, and yes, if there is a way to put that on just one sheet of paper, the names, and if you can do it as a link to get it to us, that would be great. I don't know. Does anybody have the page? So yeah, we can get that page.
This is Tabor Griswold, for the record, and yes, I did create a one-page for my own little script, so yes, I can certainly send it.
Okay. Yeah. Okay, yeah, if you can get that to us, because the other thing that I want to make sure is that people who are listening, they have a right to have the same information that we do as well, okay?
Yes.
Additional questions? Mm-hmm. Committee members, comments? Okay, thank you, Ms. Griswold. Okay. Item number 9, presentation of employment, age discrimination, and policies to support multi-generational workforce. Okay. Want to begin when you are ready? NCSO.
All right. Well, thank you so much for having me, Chair Spearman and Vice Chair Brown-May, as well as members and staff of the committee. My name is Glenn Jacoby, and I am a policy associate with the Employment, Labor, and Retirement team at the National Conference of State Legislatures. For anyone who might be a little bit unfamiliar with NCSL's work, we are the bipartisan membership and professional development organization for legislators and legislative staff in all 50 states and territories. We exist to provide nonpartisan research, testimony, and technical assistance to help the legislative institution be as strong as it possibly can. So the policy areas I work on for NCSL are relevant to this committee in particular. I cover issues of disability, employment policy, paid leave, workplace harassment and discrimination, among others. And I'm going to be reviewing ways that states are working to support the multi-generational workforce. This is a buzzword that we hear a lot about nowadays. We're going to talk about what exactly we mean by that, and ways that you as legislators can help support workers of all ages. I'm going to be going over information that was compiled not only by me, but by my wonderful colleagues at NCSL as well on my team. So I want to give them my Valentine's shout out, my wonderful ELR coworkers. So anything that they have provided in here that I will be going over, if you have specific questions about it that I am unable to answer, I can always connect you with any of them, and they are a wealth of knowledge. So we will get into it. We're going to be covering 3 different areas today. First off, what we mean when we say multi-generational workforce, the phenomenon that we are seeing more and more nowadays, which is people re-entering employment after they have previously retired, as well as age discrimination. So people are living longer than we have ever lived, which is very exciting. It also means that we are working longer than we've ever worked historically, and that comes with an array of challenges. We have 5 generations in the workforce right now for the first time in U.S. history. We have folks from the silent generation all the way down to Gen Z, all working together sometimes, which is really exciting. It creates an opportunity for a diversity of perspectives and experiences, but it also creates very unique challenges for state policymakers to support all workers, but especially older workers. So just to give a brief overview of kind of how we got here, This is a graph from the Department of Labor. It shows the civilian labor force participation rate, which is just the percentage of everyone who is working out of the overall non-institutionalized population. So the number of people working out of everybody who theoretically could work. We're seeing, if you look at the beginning of the graph, starting in 2003, we have about 66% participation rate, and then that begins to have sort of a steady decline. We see a very sharp drop-off around the time when the pandemic happens. A lot of people left the workforce or were laid off. A lot of people retired early out of safety concerns. And then as we emerge from the pandemic, we see that we are starting to creep back up, and we're essentially back where we would have been on the original trend line. There is one interesting aspect of this graph that I want to highlight for you. So this is also from the Department of Labor. It has workers broken down by age group. Each of these little sections is an age group. And it's the labor force participation rates projected from 2000 and then up to projected 2030. The main takeaway here is if you look at the slope of each of these groups, they're all descending except for the last one, which is workers 75 and older. That is increasing. So we do have fewer people overall in the labor force as we are having demographic changes, baby boomers aging, retiring, leaving the workforce often. But for those who are remaining in the workforce, the percentage of older workers is increasing. And that is similarly represented here. Main takeaway here is the outer group, so that 75 and older group. You can see that there is essentially a doubling between that light blue line and the red line. So this is the percent change in the labor force by age. That light blue is for 2010 to 2020, and then the red is for 2020 to 2030. So the decade that we are currently in and will continue, essentially the number of workers in this 75 and older category is going to double. So how do we address this? How do we ensure that these workers are having their needs met? The main discourse around the multi-generational workforce is focused on the sort of managerial side of things from the employer perspective. It's a lot of how do you as a manager support multi-generational teams? This is obviously important, but states are starting to get a little bit more into the mix and the conversation through a few main initiatives. So there is a lot of overlap between issues that are related to supporting a multi-generational workforce and how to support workers with disabilities, because as we've talked about today, disability is a natural part of the human experience, and as we age, we are more likely to acquire disabilities. And so a lot of work has been done in the disability employment space to support workers with disabilities and ensure that they can access employment if they would like it. And a lot of that work can lend itself well to supporting older workers. So, for example, providing flexible work schedules, especially in public sector employment, is one option. Encouraging private sector employers and also mandating state employers to increase access to reasonable accommodations. These are things that are required under the ADA, but that oftentimes people don't fully understand what they're entitled to, or private employers might think that they are costly to provide, which isn't necessarily true. And then also, as we heard from our lovely representative from AARP, providing supports for family caregivers, because we want to support our oldest workers, but a multi-generational workforce also means that the, middle generations are caring for their older relatives. So ensuring that they can do what is required in terms of having that flexibility to address those needs as well. Some specific legislation to highlight here. Mississippi last year granted all state agencies permission to authorize telework to any workers deemed appropriate. It is not a mandate, but it's just essentially giving agency by agency discretion to allow their individual agencies to go remote, which is kind of a unique approach. 15 states also allow telework as a reasonable accommodation for workers with disabilities. This is something that could lend itself well towards supporting older workers also. And then several states are kind of in the fact-finding period of reaching out to folks with caregiving duties and trying to determine and research what would be most helpful for them. And there's a link on the slides to see what states are doing for that sort of task force phase of a lot of these initiatives. I want to zoom in now on a sort of more niche aspect of the multi-generational workforce, but something that has seen a lot of action in the last few years, and that's reemployment after retirement, also known as unretirement. And people unretire for a lot of reasons. Oftentimes it is out of financial necessity, but it could also be out of things like boredom or wanting the emotional and social benefits that come with employment. Oftentimes people who unretire were members of a sector of the labor force that now is experiencing workforce shortages, and they see that and they want to contribute the expertise that they have and that they, earned over the course of their career. And so they might re-enter the workforce for that reason. Also, inflation is a very large reason. There was research out of the United States Senate in December of last year that showed that of people who are considering unretiring, almost half of them cited inflation as a significant reason. So just the sort of mathematical reality of that is also important to keep in mind. In terms of understanding broad trends around unretirement, pandemic inflation and labor shortages have driven a lot of people who had retired back to work. We also saw a very large wave of retirements during the pandemic, but there were more unretirements as pandemic fears waned and safety concerns became less of an issue. And people realized, okay, actually, I might not have actually wanted to fully retire yet. I might want to, get back into the workforce. This is likely to remain a trend not only this year, but probably future years as well. But when people do unretire, those who have pensions can face unintended consequences. Most states restrict the number of hours or the amount of compensation that a person can earn while still accruing pension benefits. So one way that states are trying to address this is by increasing caps on the number of hours that a person can work or on the amount of compensation that they can earn while still collecting their pension benefits. Some states have also removed these caps on hours and compensation altogether. One thing to note, though, is that in situations where this has been done to alleviate a labor shortage of some kind, oftentimes those pieces of legislation have a built-in expiration date. So you can really, shop this however you want and whatever you think makes sense for certain workforce sectors in the state. So once we have folks who are wanting to re-enter the workforce, how do we make sure that older workers are protected and understand their legal rights? We need to first understand the broad phenomenon of age discrimination and just how significant it is. So age discrimination is illegal. You can't do it. It is outlawed by the federal government as well as almost every state, including Nevada. This means any worker or applicant for a job who's 40 years or older cannot be discriminated against simply for that reason. That said, we do know from a number of studies that age discrimination is very real in the job application process. And a lot of folks report feeling that they have been treated unfairly in the course of their employment because of their age. We know that whenever there's a face-to-face interview involved in a job application process, younger applicants are offered roles at significantly higher rates than older applicants with similar qualifications. So we can chalk that up to age discrimination. So it seems like outright just banning it, while a good first step, has not completely solved that problem. So states are beginning to see this and are taking a few steps. The main trend that we've seen in this arena is that we have 5 states that have passed bills that prohibit employers from requesting age-related information during the hiring process. So not only does this mean they can't ask your age exactly, but they can't ask questions that are clearly trying to get at your age without asking it. So for example, they can't say, oh, what year did you graduate from high school? Because that would allow you to place someone's age pretty close to what it probably is. This is obviously a first step, but it is something that we're seeing as a trend in a few states. I also want to highlight here, lastly, the potential for, again, we talked earlier about the sort of overlaps between disability employment policy and policies that could be used to support older workers. I want to highlight the potential for like state hiring preferences for older workers to bring those folks back into the workforce, as well as addressing labor shortages. This is not something that I have found any states doing, but it is something that seems like it could be of interest to you all in your work. Or if not explicitly state hiring preferences, just using the framework of state as a model employer. This is a framework that a lot of folks who are disability advocates have pushed for, and a lot of states have adopted it and have found success with it. And it's just the idea of having the state create an environment that is designed to actively bring people with disabilities into the public sector workforce, and then also retaining them by creating an environment that culturally is supportive, but also is practically supportive by meeting their needs, accommodating them, ensuring that that environment is built so that they succeed. That framework potentially has implications as well for older workers. So just wanted to highlight that. So why does all this matter? It matters for a number of logistical reasons. As we have heard about today, pretty much everyone everywhere is experiencing labor shortages in every industry. That's not seeming like it's going to go anywhere anytime soon. So ensuring that everyone who wants to work is able to, and this includes older workers, is one way to begin to chip away at that. Obviously, it won't solve everything, but it is one step. We also know that multi-generational workforce benefits everybody. It creates a diversity of perspective and skills. Teams with multiple generations represented are more productive, and they also tend to create more stable workplaces because older workers tend to remain at the same job longer than younger people who are in the process of building their career and are more likely to job hop. So we have these practical reasons, but then there's also just the reason that it's the right thing to do. Work is something that gives us all meaning and connection. I really love my job. I love the chance to come here and talk to all of y'all and hear what y'all are doing to better the state. And I love hearing about your passion. And I know that your work gives you all meaning and connection as well. And so we just want to make sure that we can be doing that for everybody. So that said, if anyone has any questions, I'll do my best to answer them, or I can connect you with any colleagues who focus on certain policy areas.
Thank you. Committee members, questions, comments? Assemblyman De Silva.
Thank you, Chair. Thank you again for your great presentation. I had a question. I don't know if you may have the answer or not, but I was wondering if you have any data on unretirement in Nevada and what may be driving that unretirement in this state. Thank you.
Thank you. Glenn Jacoby for the record. I do not have any information specific to Nevada, but my colleague Angie Rowe, she works on retirement issues for NZSL. I can get you her contact information and connect you with her. She would be a really great person to answer that question. So, yeah.
Vice Chair.
Thank you, Chair. Thank you, Ms. Jacoby. It's really great to see you in person, not on Zoom. Thanks for making the trek over. Similar to my colleague, I'm curious to know if you can get additional information around the slide you presented with the 75 and older increasing, right, in the workforce. So the percent change in civilian labor force by age, and in this last 2020 to 2030, we see 75 and older folks in the workforce increasing significantly. I'm curious to know, though, if it's a self-determination or if it's driven by the economy or healthcare needs, right? Do we know what the driving factor is beyond that. Studies are now telling us that the longer you stay in the workforce, the healthier cognitively you are likely to remain because of the social interaction and other intellectual stimulation you get by being in the workforce. So I'm curious to know if this is a choice that's being driven as we are getting older and are healthier longer and able to work, or if it's driven by an economic factor.
Thank you for that question. It seems to be driven by a lot of different things. There's not really one factor to be able to pin it on. It's all of the things that you named, but we do know that economic reasons are a very significant driver, especially, again, concerns around inflation. That does seem to be pretty significant for a lot of folks. But yeah, it is driven by just a lot of different reasons, and people might have multiple reasons themselves for entering the workforce. But we don't know necessarily what the breakdown is of that significant jump in terms of percentage of each reason. But all of the ones that you mentioned are relevant.
Thank you. Senator Krasner?
Thank you, Chair Spearman. Thank you for your presentation. My question is, if a citizen sees on a federal government website that there is a job posted and it says cannot be over 60 years old, what are their remedies? What do they do?
Thank you. That is a very good question. I would be very surprised to see that posted on any federal websites, which is not to say it doesn't happen. There are certain positions that I don't know, to be honest with you, a lot of the nuance of the specifics, but I do know that there are provisions in the ADEA that state that essentially for specific jobs, if there is a very strong reason why there needs to be an age requirement there are situations that can be exceptions, but that, from my understanding, is very rare. So I would imagine a good option for those folks would be to reach out to their regional EEOC office. That is what I would recommend those folks do, because anyone at that office would probably understand the law in a more nuanced way than I do. So I can't necessarily speak to that, but I think that would probably be a good starting point.
So reach out to the EEOC office here in the state of Nevada and make them aware of the federal government posting that is discriminating based on age. Is that correct?
That's what I would recommend, yes, just because they are the ones who are responsible for enforcement of laws that protect certain classes of worker from discrimination. And so I would imagine they probably would be the best resource for that.
Thank you.
Senator Dondero-Loop?
Thank you very much. As a person who I prefer to say I've reinvented myself several times, a pilot would be a person who cannot work past 65. I believe FAA workers that, bring in our planes and what have you, I think they might have an age limit, but those would be age limits based upon that specific job, I believe. I don't know. You probably know more than I do. But I do know that there has been some discussion on the news, for example, as to, could we extend those ages because people are healthier, living longer, what have you. So that was kind of part one. Part two is, so are there sort of more, I always struggle with when I hear these statistics, are there more jobs, if you will, or because if people are looking for workers, restaurants, the legislature, school teachers, whoever they are, everybody's looking for job applicants. Where are these people? So are there more jobs? We know there aren't less people. And we know that people are retiring later, so that would put a few more in the workforce, maybe not a lot, but that would put some in the workforce. So is there any data on that or any discussion on that?
Yes, so it is a little bit counterintuitive going from the initial graph that I showed that's a declining labor force rate, and then the latter two that are showing increasing numbers of older workers. ultimately, it comes down to there is a larger number of older people in general leaving the workforce. So the baby boomer generation retiring in large numbers. While we are seeing people on a whole living longer, and that does mean that more individuals choose to stay in the workforce longer, that is not a high enough number to balance out the number of people who are retiring. And so while we are seeing more people working for longer, ultimately that long-term demographic change is what's behind that declining graph that we saw at the beginning.
Thank you.
Additional questions? So I just got a couple. So one of the things that I've been concerned about is that it's not that they have reached retirement age, but as we look at the jobs that are going to be going away by 2050, and I just pulled it up, you've got retail salesperson, cashier, journalist, market research, librarian, a lot of the jobs that we have right now that are service connected will be going away. And so I guess what I'm looking at is what can we begin to do, and maybe I already know the answer, what can we do proactively to make sure that we're using all of the educational and trade resources that we can to make sure that we're reskilling or upskilling. I spoke with one of the labor unions. Their average age of their member is like 47. And so in 10 years, 15 years, if they're displaced by technology, then I can't remember what slide it was, but, younger workers will probably get that job quicker than they will. So what can we do? Are there resources out there we should be looking at to make sure that we are including them in workforce development now as opposed to scrambling to do it later?
Thank you for that question. That's a very big question. Also one that certainly has strong implications for Nevada and Vegas, so I definitely see why you're asking it. I would say so I have a couple of colleagues who are focused very strongly on workforce development initiatives that I can connect you with, but the couple of things that come to mind for me would probably be focusing on, as you said, reskilling through initiatives that states have tried to essentially allow folks who have been in one sector for the majority of their career to transition into another. So there are initiatives that states have taken on to help reduce costs of getting certain types of degrees that are helping to alleviate workforce shortages. That could be something that would be a potentially relevant approach. So depending on if you were to enter into a sector that has a lot of need, potentially making it so that part of your education can be compensated by the state, that's one approach that we're seeing. We're also seeing a push for apprenticeships. Apprenticeships are something that the federal government has also put a lot of support behind, specifically registered apprenticeships, and that model could potentially be useful. But I can connect you with a couple of colleagues who probably know a little bit more about it in detail and would be able to provide you with some information.
Thank you. Just more of a comment than a question, but has there been any exploration to use libraries, for example, as a learning center? About 15 years ago, everybody said libraries are going to be extinct because of, the multicolored search engine that starts with a G. So can we look to do something like that? And like I said, comment probably more than a question, but.
That's another really good question. As a frequent user of the Denver Public Library system, I'm very pro-library, so I like that approach. I think it's creative. I have not seen anything at the state level related to that. I have heard just, as a person who is interested in libraries, I know that there are some county level initiatives in some states that try to create spaces for public libraries to essentially be like a first stop for accessing certain services. So I would assume that there's likely some initiatives around that. I am not familiar with it though, but I think it's an interesting approach.
Thank you. So I'm going to ask the same question, and you probably can't answer this, but is there any way to integrate these sorts of services, workforce development, by reaching out to veterans organizations? And I know the very first Veterans and Military Families Subcommittee, I chaired that. I think it's still around. But is there any way to kind of marry that with some of the challenges that we face? And also, I think that this would be a good idea for anybody that has any type of paper or questionnaire for a job application or resource application. You know, have you ever served? So that we could identify those who are veterans, and that provides another resource that could potentially take some of the strain off of limited resources in other places.
Thank you. That's a good question. I have not heard of any initiatives that are specifically related to like seeking out veterans organizations and sort of tying that to employment, which is not to say that it doesn't exist. I do know that there are a lot of state laws that have been passed in the past few years that are designed to incentivize the hiring of veterans. Sometimes it is narrowed down to service-disabled veterans, but not always. And so that would potentially be one approach there. But I can reach out to the person at NCSL who covers veterans issues. He's very helpful, and he would probably know a little bit more about that as well, and I can connect you with him.
Thank you. So state is a model employer. We had that bill and passed it last time, so you can add that to your slides. No, Nevada's doing that already.
Glad to hear it.
Okay. Additional questions or comments? Okay. Thank you so much.
Thank you.
And I'd be interested in talking to whomever is dealing with the veterans issues. And I mentioned that question because a lot of people, unless they retired, they don't believe that they're veterans. Mm-hmm. But if you ask the question, have you ever served, they can say yes or no. So.
Okay.
Mm-hmm. Okay.
Gotcha.
That's
Very
it?
cool.
Okay.
Well, thank you.
Thank you so much. Or 10. Here we go. Agenda item number 10, discussion of potential topics to be addressed in future meetings. I have some, but I'd like to hear from the committee members first. Vice Chair.
Thank you, Chair. I know that we are looking at a committee meeting that's specific to addressing the needs of people or adults with disabilities or special needs. And so I'm curious to know if we can spend a little bit of time working on sort of that state as a model employer, disparities in employment for the special needs populations and adults that are dealing with that in particular. I'd also like us to consider accessibility. As we heard earlier today, right, some of the materials are not being made accessible for people who have other barriers. Mm-hmm. And I think that's really important. So I'd like us to consider perhaps spending a little bit of time on that issue in particular.
Thank you. Committee members, anyone else? I'd like to put back on the agenda for a future meeting, agenda item number 8, because I'd really like to know what that looks like. That was the presentation on the quality of life issues and healthcare concerns related to senior citizens in Nevada. I think that that is quite germane to the work that we have to do now and what we need to be preparing for in the next session. Also like to look at how we are or are not collaborating with veterans resources to make sure that we identify and do outreach to veterans in whatever category that they're in so that the limited resources that we have can be stretched. So I'd really be anxious to see if we can't bring the agencies back in along with the Department of Veteran Services to take a look at how we do that. Looking at some of the other things that we are facing, and particularly with the reskilling or upskilling, perhaps we need to look at some of our labor partners and see if there are ways to integrate what they do with any type of pre-retirement or something of that nature for people who are or 45 or above, so that they have time to reskill or to upskill. And that would also go in line with what is available to members of the veteran community to make sure that they have these options. I know we're dealing with adults with special needs, but probably some discussion about how parents who are dealing with or have to come up with creative ways when they have children who have special needs, and what does that look like in the workforce, particularly in light of the fact that we have a lot of daycare centers that closed during COVID. And so what's available to us in terms of government funding that we might be able to look at making sure that that's available. I had a friend who has 2 children who both of whom have special needs, and at the age of 18 and 20, a lot of the resources that are usually available when we think about adults with special needs, we usually think about somebody who's over 50. But what happens to the children when they, quote, age out of the, quote, child status, and they need to have these things. So I want to make sure that we're looking at that and making sure that we have resources available, and maybe that looks like something like, maybe a town hall. I don't know. Last but not least, I'd like for us in the future to, whenever we invite someone to come and present, let's ask them what they're doing in terms of outreach and making sure that they're educating the public. What are the collaborative partners that exist? We heard some, but I think an underutilized resource is the faith community. And that's not just Christian, but that's the faith community, broad-based, or lack thereof. Some people have a faith system that is not a faith system, and so we need to be sensitive to that. But I'd like to know, what are they doing to make sure that the outreach exists? And what levers are they pulling to make sure that they're unsiloed, make sure that everybody's talking to each other, and you don't have duplicative activity going on this side, the left, and then the right, and both of them are doing the same thing and spending money on the same thing, when if they would unsiloed, then we could, perhaps build capacity. So those are just a couple of the things. Oh, I'm sorry. And we talked about transportation as well. What does that look like with respect to, like here, Southern Nevada, we're getting ready to get the bullet train. What does that look like? What can we be doing in some of our rural areas to make use of the advancement in technology and that sort of thing? And I know that when we start talking about transportation, we're not just talking about trucks and cars and buses, but we're probably also talking about what that looks like in terms of the fueling, whether we're talking about EVs, whether we're talking about hydrogen fuel cells, what are we talking about? So how do we make use of all of the resources that are available to us that will shore up and secure more transportation options for people in rural and frontier areas? So those are some of the things, and here's what I'm going to ask Ms. Cooper to do. If you will, those things that we talked about, we'll send around a survey and see how much interest there is or is not. And if mine doesn't make the list, I'm committed to at least talking about it on an individual level to make sure that we get something done. And I would just encourage you all to do the same thing. So we may not be able to talk about all of it. And maybe there's some processes and things that we talked about that could be integrated at a secondary or tertiary level. So, yes, ma'am.
Senator, I wonder if you would consider adding housing to that bill, knowing that I get seniors on a regular basis who are in fixed income households, but their rents are continuing to increase. And I think that the specialized populations, that would be an important topic for us to consider, including the long-term support services that we heard about earlier. Was our capacity as a state for people who have high behavioral support needs, as well as people who are just trying to live independently?
And I think if we couple that with the curriculum of our institutions of higher learning and even community colleges, that might be something well worth. As we talk about that, I'd like to put under that Senate Bill 363, the bill that we had last time that provides priority placement for women veterans formerly incarcerated women, women who are over 55, and housing insecure. There was another. But anyway, yeah, it's like 4 categories, but if we can do that. Because one of the things that's happening is as homelessness increases, if we drill down and take, that by, up to 35 to 50 or whatever, I think we'll probably see that there are probably more people above the age of 50 who are housing insecure. Some of them are invisible to us because they are staying with their children and don't want to. So, yeah. Additional questions, comments? Yes, sir. Mm-hmm.
Thank you, Chair. I was going to say, maybe this is out of the purview of this committee's jurisdiction, but I know we have a member of one of these organizations here, our VSOs, our Veteran Service Organizations, and maybe inviting them to come and give a presentation and overview as to some of the resources that they're doling out to our veterans community here in Nevada. Thank you, Madam Chair.
Yeah, good point. And I think what we should, with all of these topics, let's make sure that we have somebody from Nevada Department of Veteran Services and any of the other veterans organizations here that can kind of speak to whatever collaborations or not we're doing, because I want to make sure that we're fully integrated, and that way we're maximizing all of the resources that we have. So good idea, and let's make sure that in the future we have somebody here from Veteran Services that can speak to some of these issues and how we can do crosswalk. Good point, thank you. Anyone else? Going once, going twice. Okie dokie, let's move now to agenda item number 11, public comment. Anyone here in Las Vegas? And if there's someone in Carson City, if you move to the table. I see someone here in Las Vegas. Anyone else for public comment? You can move to the table too. And we will begin. Mr. Wager.
Thank you, Senator Spearman, members of the committee. I am Fred Wager, W-A-G-A-R, for the record. Senator Darrell Loop made a great comment about reinventing oneself, and I certainly appreciate that. I am now the Veterans of Foreign Wars Southern Nevada Legislative Liaison, and I was appointed by Commander Bill Pierce. We have a legislative team. We have Candace Lopez, who's the state coordinator up in the north, and Dan Sander, who's with the congressional delegation. We're all appointed by the commander. Thank you for allowing me the opportunity to make this public comment as I retire from the state and move into this volunteer position. My primary responsibility will be available to you to provide any guidance you may want as a state legislator on veterans issues that you may wish to place into a bill draft request in the next session. A main focus from VFW will address claim sharks. This is a national effort, but we are taking it on in the state. Claim sharks are those who are non-accredited individuals or organizations who are charging veterans and survivors for assistance that is provided free by accredited organizations. There are already bills in New Jersey, Nebraska, and Florida, and we are looking at those to provide information to this committee and others as we go forward. Another issue is the item of compacts. I heard that mentioned earlier between states that allows individuals, especially military spouses, who have their military members moving to Nevada on military orders, and with the spouse having to start over in employment, as Nevada has no compact. And I know with my wife, she followed me all over the country as I moved around in the military and had to start over each time. We will be working closely with the United Veterans Legislative Council on pushing veterans bills to continue the legislative success seen over a number of years. We have the list of recommendations from the Interagency Council on Veterans Affairs, the Veterans Service Commission, and the Women Veterans Advisory Committee that was recently sent to the governor and the LCB for distribution to the legislators and has been published by NDVS on their website as well. And we'd be happy to discuss those at any time. I've heard it mentioned numerous times today that it is Valentine's Day, And so I want to thank my very patient wife of 34 years, Terry, for supporting me as I transition into this new position. I think she thought I was actually going to retire. I don't know where she got that idea. But I want to thank you for all you've done over the years, for veterans especially, and I want to thank you for your time today. Have a great day.
Thank you. Anyone else down south? We have anyone up north? Public comment? Don't see anyone.
Oh, Senator
Yeah.
excuse me, Chair.
Senator Krasner.
Mr. Wagar mentioned that he has a list of priorities that he wanted our help with. Would it be possible that each member of this committee gets a copy of that list via email, please? Thank you.
Yeah, we can do that. Yeah, we can do that. Okay? Oh, we can do that.
Thank you. Thank you.
Okay. And so mine is Assemblyman Gray. I think you're still there. I owe you an apology. I got really animated when we were talking about veterans who were discharged under Don't Ask, Don't Tell, and I hope you didn't take that personal. It's just that that's a real sore spot because I know there are a number of people who served their country honorably, some who died in Iraq, and some who came home with missing limbs, and still were not able to stay in because of who they loved. So please forgive me, my humble apology, and I'll try not to be as animated the next time, okay?
No, it's unnecessary. We're both, like I said, both on the same side. I was just interested if we could go back and capture the ones before Don't Ask, Don't Tell, because there are a hell of a lot of good people that served. I mean, they bleed the same way you and I do, and, there was, really no reason for it.
You are correct. Let's talk, okay? All righty. Have we said everything, done everything that we came here to do? Okay, and with that, we will end this meeting. Our next scheduled meeting is Tuesday, March 26th, 2024, beginning at 9:30 a.m. We are now adjourned.